Yeah, people will fucking say to me, "Oh my God, you got breast cancer? That's how my grandmother died. That's how my aunt died." And I'm like, "Boop, conversation over. Fuck you.
Yeah. So
Go
for
away."
anybody who's in chat right now, none of that bullshit, please.
None of that bullshit.
We
Fuck
are
off.
we are not looking to have any correlations between
No,
anything that is currently happening with any of our presenters
no,
with things that have happened in the past that are of a negative nature. We are looking
no.
forward positively.
Oh, I don't even need to look forward positively. This is what I keep saying to people. I can be as negative as I fucking want because the science still tells me I'm going to be stuck on this fucking rock in 5 years still dealing with
Yep.
this same bullshit. So it doesn't matter that I got fucking cancer. I still have to get up and go to fucking work because this isn't going to be what kills me.
Yeah,
Statistically, it's still
exactly.
my ex-husband.
Oh, wow. Oof. I started laughing and then I was like, oh, fuck, that's not something I should laugh at. Jesus. Holy
Welcome
shit.
to Two Girls, One Garbage Can, the Trash Fire podcast, Ozpol podcast, where we talk about the garbage can state of not just Australian politics, but the entire Australian national landscape, and try and make sense of it using an historical lens, because sometimes the only thing you can do is try and warm yourself up next to the fucking trash heap. I'm Tamara.
And my name's Maddie Mohawk, and while Tamara deals with either Mac or Cheese, who is coming in, I will say that may be one of the spiciest intros that we've ever had to the podcast. That was something else. So, as you can tell, we
Sounds
are in
good.
fiery moods right now.
Of course we
And we
are.
have a lot of stuff to talk about. And if you've had a look at the title of today's recording, you will know that today we are talking about the history of Medicare.
We are our wonderful national treasure, Medicare. And can I just tell you, that was certainly a new way to say hello. I've been working on my introductions. Can I just tell you that I have in recent days become not just overwhelmed with how wonderful Medicare is, but truly in awe of how you said Medicare might have to dip. Sorry. But can I just say, just in awe of how fantastic this system is, considering all of the markers that are sort of against me in terms of getting my diagnosis getting sorted out, you know? Fair enough. Lipstick, no stress. But having access to everything that I needed to get a diagnosis, and it's not just for me. There is something called the no worries. Hello, how you going? Now, I want to be clear, this isn't just for me. I'm not just like, wow, I've had a great experience. But because of my recent experience being diagnosed with breast cancer, I've learned about something called the optimal cancer care pathway.
Mm-hmm.
And what it basically is from beginning of noticing your symptom to the end of treatment, you've got a time frame in which things are going to happen for you. And they give it to you at like the get-go. Within 3 days of finding, this lump that I thought was a lump wasn't just a lump.
Yep.
I was connected with a cancer care nurse who'd given me a copy of the the cancer care optimal pathway. I knew exactly what was happening when I had appointments booked in where I was supposed to have them. I've got results as soon as I'm supposed to have them. I had one result, was 48 hours late, and I got a call from the nurse to be like, hey, just letting you know it's not because there's a concerning result or anything. We've literally had, someone went home sick, and so we're just a bit of a backlog on those results coming through. I'm chasing them up for you today. Just wanted to put your mind at ease that it's not because we found something. It's because we've had someone go home sick. That's what's going on right now. So
That's really impressive.
Yeah, it's because of Medicare. This is... And they revised it during COVID because they wanted to ensure that there was separation of care between cancer patients and other patients as well. And so there were revisions that ensure things like the timing of my appointments, I've noticed, have all been around 2 different times of day, lunchtime and school pickup. And I kept sort of saying, it's a bit awkward having my appointments right at school pickup. And they said, yeah, we clear the waiting room, though, so that you don't have a whole lot of sniffly people hanging around. Like, we book our cancer patients in so that you don't have, like... and it's these windows because it's when people don't tend to be coming in.
Of course,
like, you don't have walk-ins and things like that, because they also try and avoid walk-ins during those times.
Yeah.
So that's why she sort of said, yeah, sorry, we do it on purpose.
Yeah.
But the amount of thought that they give to these sorts of things is like, wow.
So before we continue, just two things. Someone mentioned that we need to get louder. They're at maximum volume and struggling to hear us. Lily said it.
Yep. Is that? I know that's going to be better for me. I don't know if that's going to be better for Maddie. Do you have volume up on your mic?
I
Maddie?
don't have volume up on my mic, but I can do volume up inside. Oh no, I'm on max volume.
Yeah, I've already put you on max volume.
I see.
Yeah, and in
Let's see how
saying
that
that, I
goes.
also want to point out how terrible Medicare is as a system because of our chronic underfunding it. So, in order for me to be able to follow this optimal cancer care pathway, I have to be seen by private clinicians. All of my tests have been done by a private organisation.
Yep.
Because in order for me to follow that system, I have to be treated privately because the public system is so overwhelmed.
Yeah. Yep.
So this is what I want to talk about today.
And it's funny because I have experiences on both sides of the Medicare system. So I'm quite uniquely posed to be able to discuss this as well with you. So, yeah, I'm quite looking forward to this episode. This will be an interesting one.
Yes. So I'm going to have to turn my gain down a little bit because you can pick up the kids now. Sorry.
Yep.
There we go. That's a bit better, I think.
Yeah. Yeah, that
It
sounds
is still
okay.
school holidays. Now, I do also want to point out, though, that this is the difference between also being where I am versus being in a city versus being somewhere more remote. So I'm in the perfect subcategory where I'm quite close to a regional hub, which means I have access to certain clinics and things that other people in other regions won't have access to, but I don't have the wait times of being in a public city either. So
Yeah,
I
exactly.
was put on the wait list for a colonoscopy and an endoscopy 6 months ago. Well, for my first appointment 6 months ago. Had my first appointment the other day. Told her, by the way, I've just been diagnosed with breast cancer, but I think this might be a separate issue. Luckily, she agreed. She was like, "Yeah, I've never heard of breast cancer giving you chronic diarrhea." So, well, yeah, quite early diagnosis. It's okay. So, for those who aren't yet aware, we're not dooming about it. Absolutely not. So,
I got you, boo.
so one of the things that, for anyone who's listening, I have been diagnosed with breast cancer. The type of breast cancer that I have is called invasive ductal carcinoma. Invasive just means it's not in situ. Invasive is the opposite of in situ. It's not that it's like metastasized, invaded my body, It's just the difference between, is it contained within the duct or has it spread to the surrounding breast tissue? Mine has invaded the surrounding breast tissue, which makes it IDC, and that does warrant a hysterectomy. Hopefully it warrants a hysterectomy. That's what we're hoping for. Fingers
That's
crossed.
the end goal of all of this, is we also get a uterus.
Yeah, uterus, the uterus. Literally, when my kid was we were talking about it, the first thing my son says is, so you're going to have a surgery, but hopefully they take your uterus too. I was like, yes.
Your boy gets it.
He does. He gets it. Hey, mate, can we not do that inside at the moment?
All right.
Thanks, Mac.
No.
Where's Cheese?
Cheese is out in the garden collecting some cutlery because Dad asked her to.
Okay. Good plan. I'm just going to move that out the way instead of trying to move the camera again, because the camera just keeps moving. So we've given up on trying to move them. Boot the ute. Absolutely. Boot the ute would be great if we could manage that in amongst all of this.
Yeah.
So
Might as well get something good out of it.
absolutely. So basically, I've just said I would rather not have chemo. I would rather just jump straight into surgery, and then I am going to have radiation after the fact. But because I won't have chemo beforehand, because I'm going to do the full mastectomy, then I won't have as long a recovery time before beginning radiation, which bonuses all round. Sooner I can begin, the sooner I can end. Yeah, linings
exactly.
everywhere. Some of them are made of gold, mate. Like if I can get rid of this uterus, if he tells me that I've got triple negative and I get this uterus out, like this is what I'm waiting for on Wednesday,
Yeah.
I'm just like, oh, bitch.
I've got my fingers crossed for you as well, hun.
Thank you. That lining will be gold, silver, dripping in jewels. Oh, bedazzled. Oh, some guy said my aura's moonstone just because he was high. Or maybe I was. I can't remember.
Oh, Maddie, that's such a... No, I have to say it now because the thoughts cross
Do
my
it.
brain.
Do it.
It'll be a gold panty lining for dealing with the after effects of having a uterus.
Honestly,
the thought
though.
came to my mind and I was like, that's so inappropriate, but it's also very accurate.
One of the things my doctor said to me. So my GP's been so good. My GP said to me, look, great that you're so open to surgical intervention. One of the things to bear in mind is that it can affect your, libido. It can affect moisture levels. I know everyone hates that word, but there's just other effects that it can have. And I said, bitch, I am dripping 24/7. If something could stop this up, that would be great. Like,
Oh,
my
God.
vibrator slips right off. If you're telling me there's something you can do to stop the floodgates.
I swear to God, when I got my vasectomy, the doctor was like, be aware that this can reduce the volume. And I'm like, bro, seriously? Please.
That's fine. Less mess is best.
Please. It hasn't. It's made it worse.
Yeah. No. Fix this. Why did it do this? It was supposed to be the
Christ
opposite.
alive.
No.
Fucking fire hose, bro.
No, absolutely not. So, where have I put my bloody phone? This is annoying. That's got my script on it, and I don't know where I've put it. Oh, it's behind me. It's okay. One thing I will say, and this is the other thing that made my doctor laugh a little bit, was I said, God almighty, I'm glad it's just breast cancer. I was worried it was long COVID. The exhaustion, the brain fog, like the loss of appetite. I was like, God, it's long COVID. What am I going to do? And she's like, no, it's breast cancer. And I went, oh, thank God. Oh, sorry,
bro.
Lily.
I get it. I get it because I've been dealing
You
with
with long
it as
COVID,
well.
get it.
Yeah. Yep. But I totally get why you're stoked it's not that, to be honest, because it is a pain in the us.
Yeah, sorry to all my friends with long COVID. I honestly thought it was long COVID, and I was like, God, I feel 80. This is miserable. And they're like, it's just cancer. And I went, oh!
You mean we can cut it out? Fucking dope.
I mean, and this is the thing the doctor did say to me is, radiation is going to knock some energy out of you. You're not going to be And this is what I said to the doctor. Look, I know that some of this is cancer and some of it is just being 37 years old. Like, don't get me wrong. So I'm not expecting to be a spry 20-year-old again after I've had like cancer surgery and radiation therapy. But some things like the brain fog and being able to walk up a hill, I'd be really glad to be able to have some of that reduced just a little bit, or at least not getting any worse, because it has been progressively getting worse. Which, apparently radiation is going to make it worse. It's called cancer brain. And radiation is not going to make it better, but then it will, after like 2 years after radiation, your brain starts to repair itself.
Yes.
So I've decided to sign up to do a master's, to continue doing my master's, I should say, throughout this process.
Wow. I wish you all of the best.
I'm just like, you know what? I got nothing else to do. I'm going to be sitting in hospital reading.
True. True.
Yeah. It might not be my doctors are pretty diligent. Yeah, I hope that you know what? It could be something like, gotta be honest, it could be something like, what's that one that all the kids get? The kissing disease? Not saying that you're a horny bitch, Lily, but you are. Oh, Kelly, thank you so much. Honestly, I'm not even kidding you, when I first got the diagnosis, my first thought was to call you and just be like, bitch, come meet me at the beach before I throw myself in the water. But yeah, I don't know. I was still in processing mode. I wasn't quite ready to, I didn't know how to say it at that point. So I just thought, it's going to be really awkward if I'm just sitting there crying and you're like, why are we crying?
I don't know what's happening.
Yeah. It's very sad, whatever it is.
Oh, fuck.
That would have been me, honestly.
I have learned enough that if a friend calls me and they are upset and crying, I am to sit and make reassuring noises.
Yes.
And
yes.
give the big hugs that I am known for.
Yeah.
And that is why I have been called. And then once the calming happens, then I do the more talky and supportive noises.
Yeah. Yeah, the holding the space part, that was the thing that was, so when I first got diagnosed, the kid's dad was obviously here because he'd been watching the kids, and which, by the way, is part of the reason I don't need childcare, is because I have live-in childcare now. It's really handy as I go through this process, not going to lie. It's like everything in the universe happens for a reason. Who would have thunk? So I came home and was just like, yeah, I've got breast cancer. And then all these questions started flooding in at me. I'm like, how the hell am I supposed to know? Do I look like an oncologist? Do I look like a breast surgeon? Do I look like a cancer specialist? Like, do I look like I just became an expert in breast cancer in the last 15 minutes? What the fuck is this childish response?
I mean, it's you. You could have.
To be honest, by the next day, I did have answers to all of the questions. But the point was, well, to be fair, I did already have answers to all the questions, but I wasn't interested in talking about it.
Yes.
I was like,
Tamara,
why do
the
I have to
overnight
tell you?
oncologist.
I had to look it up for myself. You go look it up for yourself.
Yes.
I did. Oh, I thought someone was saying it was April Fool's, and I was going to say, is it? I promise I would not do that for April Fool's. Like, that would be way too cruel. Oh
No,
my God.
absolutely not.
No. Honest to God, can I just tell you, when I first found the lump, I told no one. And I started binge listening to podcasts about influencers who made up having brain tumours for clout.
Yep. I know exactly who you're talking about, by the way.
Because she was an Aussie.
Yep.
I wanted to do a Two Girls episode on her one day. She was just hilarious. You're the April Fool. Yeah. So I honestly was just like, you can tell no one or you will be this bitch. You'll be this bitch who's
Jesus.
like, trying to find a way to backtrack because you overreacted about having a funny episode and decided you were dying.
Oh my God.
So I literally didn't tell anybody. And then, this is me, I got the results of my ultrasound 7 days after the ultrasound and looked up what all of the signs and symptoms meant and diagnosed myself and went into my GP and told her what I had. And she said, "How did you know?"
Because I am a competent researcher, ma'am.
And I just had to laugh. Because I feel like in that moment I made my GP feel really useless. And this woman is the best doctor I've ever had.
I don't know, Callie. I very often kick my wounds.
I'm sure we're more like cats. We care to admit, retreat and lick our wounds aloud. Yeah. Yep. That is me, 100%. And I know part of it is, and I was talking to a friend about this earlier, and we will get back into the episode, I promise. I do have it here. I'm going to talk about the beginnings of this poor little
That's all
false
right, mate.
starting
We
episode.
always do this. We always
We
do
do.
this. We do like 40
It's not
minutes
even
of
been a full
rambling
hour
before
yet.
we actually get into the episode. So keep on.
Yeah. So, I just want to point out that hospital and medical expenses were one of the largest personal reasons for bankruptcy in Australia prior to Medicare. Just pointing out, we very clearly were going the way of the Americans
Yep.
before Medicare. Anyway, just that's the reason we're talking about this today, because as much
Yes,
as it
it is.
sucks, this is why we have to protect it so much. So much. And also, I had to process my emotions and info first. Yeah, me too. And I also feel like with the retreating, and I was talking to a friend about this. That's what I was saying. Sorry, got distracted. I was talking to a friend about this morning. A part of it is also the awareness in me. Well, the reactivity thing where you're kind of like, I know I have trauma. I know I'm autistic. I know I have generalized anxiety disorder. So I'm going to be having responses that are heightened as a result of all of these. So I'm trying to figure out what the appropriate response is in terms of how do I process this healthily for someone who has trauma, specifically related to healthcare trauma, like very specifically healthcare trauma. We could get into that later. Anyway. People
Trying
act
to
like Stolen
diagnose the
Generations was all
appropriate
this time
response
ago.
path is
Hey?
difficult. Trying to diagnose for yourself the appropriate response path
Yeah.
is hard. Like, what level of stress should I be? What level of panic should I be feeling? What level of you know, this, that, or the other? But
Yeah.
at the end of the day, like, whatever you
Yeah.
feel is the valid response.
Yeah, but like Caliana says there, it's that trying to balance validating your emotions while also not spiraling in them. Because the problem with
absolutely, yeah.
being generalized anxiety disorder is that can very quickly spiral into a really, like, for me, a dissociative episode, which I did disassociate for
Yeah.
like 3 days.
Been there.
Which, yeah, quite handy when you've got kids to just sit and vague out because they just come up to you and go, Mum, Mum, Mum. And you're like, oh, yes, sweetheart.
Hello.
Completely unaware of all of the trashing of the house that they've been doing. And so they're just in a pig in shit. They're having the best time. They get to yell at Mum and she doesn't care and do whatever they like.
Oh, hi, Ed. Just saw your message.
Oh, was that Ed? Oh,
Yeah,
hey,
Ed
Ed.
Progressive. Hey,
I did get
Trashes.
your text message. I was planning to text, but I didn't know how to text and be like, hey, dude, I have breast cancer. That kind of felt really awkward
Who
to put
starts
in
a
text.
conversation like that?
So I thought I'd call and say it. And then I was like, you know what? I'll wait till I see it on live. And then I'll be like, hey, dude, I have breast cancer.
So, welcome to the stream.
Welcome to the stream. Yeah. So,
But, as we've told chat, we are not dooming about this. We are.
oh no, I think the vibes are very clear to get
yeah.
very early on. It's not.
Yeah, good.
Yeah.
I just want to make sure.
I mean, I'd expect that level of bluntness. Also, can I just say, who has got the greatest excuse for not responding of all time? Me! This bitch. It wasn't ADHD, it was breast cancer.
You try that shit on me and I will call you on it so fast. I have absolutely no chill, bud.
Oh, yeah, and I would still be like, and it was still breast cancer. So.
Me being like, yeah, making excuses for your ADHD doesn't work when you're speaking to someone with ADHD. And you're like, yeah, breast cancer made my ADHD worse. Fuck you.
Yeah. Breast cancer comes with brain fog. Didn't you know? Thought it was long COVID. Thank God it was only breast cancer.
Oh, shit.
Yeah. I do need another one. Yeah, definitely. This is gone. Mm-hmm.
Callie,
that
don't
is
reply
valid.
when my coffee is the wrong temp.
Where are you going? Oh, yep. Okay. I wanted some stuff, but I can't think what. Cheese.
Get yourself a little treat. Because, you know, we have a thing in my house where if we have a little treat, we pick it up and we're like, maybe this will fix me.
Yeah.
Like every time, just before you have to treat, maybe this will fix me.
I know I have, you know, all these serious mental health conditions brought on by years of trauma and neglect.
Oh, yeah.
But this lip gloss is going to cure all of that.
Exactly.
I just
exactly.
know it.
I am putting every egg in the basket of this lip gloss.
Can I just tell you right now, if I ever do an ad read for a company, it'll only be if they let me do that.
Yes.
Like, I know I have breast cancer, but this lip gloss is just going to make all that better. That
I'll
has
have to
to
come
be
in
the
with the disclaimer at the end. I'll have to come in
lip
with
gloss
the
does not make
disclaimer
breast
at the
cancer
end.
better.
In no way are we saying that this lip gloss is a cure for breast cancer. Please do not believe that. That is just some marketing riz. Stop believing it. This does not cure breast cancer.
Every single time I recolor my hair, I'll never disassociate again. Yeah. Purple is going to fix everything. Yep. Hey, first thought when I got a breast cancer diagnosis was let's go get some sexy underwear and do a boudoir shot. Then I went, I'm not wearing underwear now. I don't own any underwear. I don't do underwear.
Why do you need underwear for a sexy boudoir shoot? That's the question that I have. Like, it's not a requirement. That's what sheets are for.
Yeah, I could maybe get behind something. Oh, you know what? Do you know what? When you said that, I picture, Helen Mirren, fuck, I could fuck that bitch. Ha ha. If she would let me, I tell you what. She did a photo shoot in a milk bath.
Yes.
Tits out. Oh my God. That woman
Yep.
is a goddess.
Agreed.
I've been having trouble getting off, but I think I figured out how. I think I've just remembered how.
That'll do
Buy
it.
yourself some new Peter Alexander pajamas. I started making myself some Victorian underwear.
Yes. Yes.
Yeah,
With
it's a
the
full
leg tie-offs.
Yeah, it's a full what do you call it? It's got lace like this all over it,
Oh, excellent.
and it's completely
Excellent.
transparent.
Fantastic.
Because of course,
Yeah.
Victorian underwear was completely transparent.
Yeah, absolutely.
They had so many layers of clothes over the top.
Yeah, you were never going to see it. That was for the
No.
people who you wanted to see it.
And the best part, because all the layers had to be so thin because you had to wear so many of them. He clutches my pearls. Yeah. You do have to wear clothing underneath it if you're going to model it for people you don't want to see your tatas. I don't do sexy, but definitely appreciate in others. You've just got a different type of sexy, and that's
Yeah.
fine too.
Yeah. The thing is, there's so many people who don't like their own appearance, and I'm one of them, right? So I'm speaking from a place of knowledge here. But I had it explained to me that, like, just because you don't like the way you look doesn't mean that other people won't. It just means that you're not your type.
Yeah.
And
Yeah,
that
you're not your
allowed
type.
me
Don't look for
that
someone who looks
allowed
like
me
you.
to understand, like, that my reality on my appearance isn't the predominant one. I'm just the voice inside my own head. And because I have access, because that voice inside my own head has access to all of my paranoia and worries about my body, it's going to pick it apart. Because it already knows the hacks to get there. Yeah, that's kind of the reason I do tattoos and piercings and hair color, is because it makes me feel more me. Not necessarily
Yeah.
more attracted to me, but more like me.
Yeah.
Yeah.
I like the Chapel Roan song, Red Wine Supernova. I feel like in that song, to me, and I know music system, I'm not saying this is what the song's about. Like, you don't have to have the same reading of the song as me. But to me, she says in there that the person she's making out with is attracted, like, she's saying, like, I'm really attracted to you. I find you really sexy. I find you really hot. You're like magic on legs. I'm really attracted to like girls with red curly fiery hair and big personalities. And so in my mind it reads like her fantasy of what the person she finds attractive thinking about her, if that makes sense.
Right. Yep.
So it's about, if you could read the person's mind who you were fucking, this is what they'd be thinking.
Oh yeah.
Like,
Like, the amount of times I've turned to my partners and been like, fuck, I wish just for a day that you could see yourself through my eyes.
yeah,
Like,
yeah.
just for one fucking day, so that you could understand, like, the
How attractive I
depths
find
of,
you.
of what this is. Like,
Yeah,
because
don't
it's
worry,
not just
guys.
some
The
passing
Kofi
thing.
of Maddie licking us all, getting us all off is coming.
Hey, look, you want me to make a proper one rather than one that's just cut from various bits of our podcast? I can make that happen.
No, I just have to go through every episode one by one and cut it all down before I download the next file, because otherwise it gets too big and I can't open it, because I'm doing all of this still, because I can't afford editing software. I'm doing all of this in iMovie,
Yep.
so it's a piece of shit.
I will find you some editing software that I have a license to for you to utilize.
Oh my God, that would be amazing. Oh my God, that would be amazing.
Just
Oh my God.
give me a week to search through my computer files, and I'll see what I can find. I may
just
have to
tell
send
you?
it down. I may have to send it down on a thumb drive, um, because it might be too big to put on like a Google Drive or something like that.
Honest to God, even... That fucking kids, I tell you what. Outside!
I'm just reading the comments now.
But Dad, this is what it's all about. Yes. What were we saying? I completely got distracted then.
I was saying that I will find you editing
Oh,
program
that's right.
that I have a license for and post it to you.
Honestly, if I didn't have to, if I could, I'm not even fucking kidding you. If I could even, because I used to have a Windows PC, and so I used to have the Windows editing software. It's so much easier than iMac. So much easier. Even if I could just save my bloody transitions, like I've gotten around it at the moment by creating everything in Canva and then downloading it into.
Wow.
Yeah, that's how I've gotten around it. It's.
Oh my God.
It would halve my editing time if I had.
I'll get you sorted. I had no idea that you were dealing with such horrors. Let me get that solved for you. Give me a week to find the file. I'll find out if it's small
you're
enough
amazing.
to put up on Drive, and if not, I'll get a thumb drive and post it to you express.
Oh my God, you're amazing. And honest to God, I will never complain about editing again. I swear.
No, please complain as much as you want still. Regardless of having good software, editing is still bullshit.
No, editing in iMac is bullshit. Editing in other software is fun. Like, it can be really fun if you're not... The irritating thing about iMac is that you figure out how to do it, and then you have to recreate it. And it's just the grind. It's the grind. Because it's like you don't do it once and set and forget. You have to do it again every single time. And because... And it's like 8 hours since I did it last time. How did I do that again? Oh, that's right. Like, and And by the end of, anyway. And then I've got problems with the upload. Today's episode will be out tonight. Well, last week's episode will be out tonight. And next week's episode will be out for Ko-fi members tomorrow. Sorry. Oh, it's about editing. It's fine.
Yeah, it's backstage nonsense that won't go into the real episode.
No, I am so itchy though. The stitches are itching the shit out of me.
Yep. All right. Well, here's a thought.
Yeah.
Let's jump into the episode itself.
It's been 38 whole minutes. Where's... Yeah. Yeah.
Hey, chat. I'm going to do a little growl in Tamara's ears to get her attention.
Don't you dare. Don't you
shit,
dare.
That's right. She's wearing her headphones. Damn it.
Yeah.
She could
Also,
read my plan.
otherwise the growl wouldn't work. Also, I made naughty
I'm in
brownies.
full himbo hours at the moment. Don't stress.
I made naughty brownies.
Oh,
I know.
fun. Do you want a brownie?
Yum. I did request a brownie. The brownie is coming.
Oh, good, good.
Yeah. Tara, I want one. I will make you some. I'll make you as many as you want. So, I've been using my vape on my evening walk when I go out with the kids, and then I will store my vape juice, my vaped herb separately, because that is what you need to do to weed to cook with it. You have to decarboxylate it, so you have to heat it up a bit first, but not black, just brown.
Brown.
But like a toasty brown.
Yep.
So I can vape it.
Weed is perfect.
Yeah.
Because you
So I
get,
vape it. put it in the
80
pot.
to 90% off of the vape, and then the remaining 10% is
In the
decarbed
cookies.
herbs that you can use to make butter.
Yep. Smart.
Oh, very smart. It's
Smart.
recycling. It's snout to tail butchery of
It,
wheat.
it's just. Hey? Well, I can't help it. It's itchy. It's like, you're feeling your tit up online. I'm like, yeah, it's itchy. Now, I got to show you. Look at that cross section. Look, those are all chocolate chips.
Oh, damn, that's a
And there's
good
also
ass looking
walnuts in
brownie.
there. But that was just all the chocolate chips.
You don't
Let
need
me
to
see.
stress about the filling your tit up on stream because the camera isn't angled down low enough for anybody to see it.
Yeah.
So don't stress yourself.
No one
You're
can
all
tell.
good.
You're missing out on the actual feeling up. Stop that. Isn't it
That's for
delicious?
after we finish recording the episode, the cameras get tilted a bit further down and you can see that neither of us are wearing pants.
On the Kofi
And we've both been
edition,
playing with
sometimes
our
we
Yetis
stand
this
up.
entire time.
We have to put it behind a paywall or we take it off YouTube.
Oh yeah, of course. That goes on the Kofi.
I need a new vape because I find that vape ridiculously difficult to breathe through.
Which vape is it?
It's like a long cylinder. Oh, it's the Rush vape. How did you know that immediately? Yeah, it is. That's the name. It's Rush. How did you know that? As soon as you said it, it triggered it. But how the fuck? Lily is a savant. Lily is a fucking weed savant. Look at those walnuts.
Very good.
Yeah, it's near the front door. No, it's not the vape that they sell you with your prescription. I haven't bothered with that one. I've tried 2 different ones and I really like the one I tried first. And that's why I gave it to my friend. Oh, let me grab mine. I'll show it to you. I'll show it to you. Maybe that's where I know the name Rush from. Maybe I'm being a dickhead and it's not called the Rush one at all.
Tamara's away from chat. Party hard. And I know she can hear me, but she can't see what you guys are saying. Hey, chat, actually, am I loud
it's
enough
not
for you
called
guys?
Rush. It's called Slick. It's called Slick.
Ah, okay.
Oh, it wasn't there anymore. But now it's not going to go back there either because I'm going to leave it back over here. But it did used to be there. But Adam's moved back in since you were last here, so things have been moved. On account of I got breast cancer. He was planning on moving back in anyway, but not permanently. Only while he found
Yep.
somewhere else to live. And now it's like, just while I have cancer. You know where, like, my desk and everything is, and my piano and couch? None of that's moved. But, like, a lot of my things have had to be moved, which is annoying.
Yeah.
It's fine. I'm happy to have a housemate who does all the chores. Literally all the chores.
Hey, that works.
Oh, tell me about it. All you gotta do is get yourself some breast cancer and you get a free live-in maid. It's
Hey,
great.
man, happily, if it means that I can have a double mastectomy free on the fucking state, I'll take it. Thanks.
I'm not going to pretend that I'm like holier thou either. First thing I googled was, does Medicare cover breast reconstruction surgery? Good news,
Yep.
it does.
Yeah. Yeah, in the case of mastectomies for cancer, it does.
Mm-hmm.
Yep. They'd save some money on me because I wouldn't want them reconstructed. Just take
A lot
them
of people
away.
don't, apparently.
I'll draw some fucking nipples on with a Sharpie. That way I can change what they look like every week. It'll be fine.
Well, because those who tend to get breast cancer tend to skew older,
Yeah.
it's actually pretty common for women to turn down reconstructive surgery post breast cancer,
Yep.
which I thought was interesting. Yeah. Here we go. Them flexing about getting a hysterectomy and free titties. I know.
Well, that's what I've been saying
Hashtag
to you,
blessed.
Tam. Like, do the comparison photos. It'll be so much fun.
I want to
Here's-
show you
here's-
something.
Here's the now. Here's the later.
I got to show you something. Yeah.
Okay.
Now they're traitors. Like, now she's literally trying to fucking kill me.
Well, yes. Yes.
Monique
but,
the
like,
Mass and her fucking
You
minions.
always get a mugshot of the criminal, right?
Got to get a mugshot of the girls before they do their attempted murder. Caught in the act.
It's nice to know who's
Caught in
coming
the
for you,
fucking
man.
act. I got to show you. I made this book. And when I say made, yes. I got to see if it works though, because I had to also make the glue.
What? Me? Because if the question was aimed at me, Lily, the answer is no.
What was that?
Just answering
So I made
Lily's
this.
question. Yep.
My dress tried to kill me, so I got rid of them. Yeah. So this, I managed to make it upside down on both sides.
Nice.
I feel like that is perfect, actually, because this is going to be my breast cancer diary.
Oh, yep, yep.
So I feel like that kind of works. So I made this. Hi.
Yep.
So, oh, this paper stuck.
Oh, no.
So I had to get the paper. Oh, I haven't finished it yet. Don't worry. But I also had to make the glue because I didn't have any glue. Did you
Yep.
know that you can make your own bookbinding glue?
I did not.
Yeah, I did, and it worked really well. I wasn't expecting it to work that well, if I'm honest.
Nice.
I am going to recover it because I've decided that this cover is too big. Because it is. I mean, look at it. That's ridiculously big.
No, there is nothing Tam can't do, Lily.
But yeah,
You're a multi-talented god.
don't. So I stitched the papers together. But can I tell you my favourite part, right? Is because that's just normal cotton. Okay?
Yep.
They try and charge you through the roof for bookbinding. Like, they call it, like, bookbinder's thread, waxed
Yeah.
thread.
Yep.
And literally all you got to do is get yourself some fucking beeswax.
Yeah.
Melt
Rub
it
it
up,
on the
mix it
cotton.
up with some pine resin and wax that shit up like you wouldn't believe.
Yep.
And next minute,
You've got your
yeah,
own.
there it is. And it's like, it's super, it's perfect. It's fucking
Yep.
perfect. It's amazing. I've got so much left over. But yeah, so I got the paper. And
I like it.
then I do have to fix the cover though. I'm not really that impressed with how I did the inside of it. Look at that. It's pretty it's pretty shoddy. Look at the top.
Oh, yeah.
It did not stick very well.
didn't go as well as you hoped it would.
Well, it was quite hard to get the leather to stick with my homemade bookbinder's glue. As in,
True.
it didn't stick at all. But the paper did. All the paper stuck down. And the fabric stuck to the card with my bookbinder's glue really well.
Nice.
So, you know, not all bad. Definitely going to recover that, though.
Fair enough. Next little project, eh?
Ah, I'm pissed that someone got sick, which will delay the cult mune. Who said? I don't remember saying that.
You are very much underestimating Tamara here. This motherfucker planning on going back to bloody uni while they're going through treatment. Like, there is not a thing on earth that can stop Tamara as far as I'm concerned. I've decided now that they are the unstoppable force. I am not willing to meet the immovable object for fear that it might actually be me.
I am going to tell you, though, that I was really happy with the way I did these corners. The glue
they
on
look
there I
really
have to
nice.
wash off. But those
They look
corners,
really
and look at
nice.
that. Look at that uneven, the glue that got on the front.
Yeah.
Well, the back, actually. That's the back. That's the front. It's upside down. I know that. Anyway, I know that works as a good paper glue. You have to use it when it's hot, though. I had to keep microwaving it to keep it runny. And it has stuck that ribbon down really well. Really well. Like, that's not moving at all. I don't know. I'm quite impressed by that.
Yeah, no. It's very, very cool. Like, having the ability to make your own bookbinding glue is kind of wild. Not something I'd ever considered.
It's literally just... Hang on. 3 ingredients. Gelatin, glycerin, and vinegar. All ingredients that are just in your cupboard.
Wild.
Yeah.
Trying to work out how that works on a chemical level.
So you melt the gelatin in the boiling water first. Sorry.
Yeah.
And there's also boiling water in there. Melt the gelatin in the boiling water. Chuck in your glycerin. And then throw in the vinegar and mix to combine. And make sure that you use it while it's hot.
Huh.
Yeah.
Interesting.
Yeah.
Interesting.
So there you
That's
go.
really cool. Today I learned something new.
Yeah. And this is the thing too, people, it's just like, I think, hashtag this is what autism looks like, I guess. I want to know how to do something. How did they used to do it back in the day?
Now I
Before they
know
had
how to do it.
PDA. So yeah, so this is my cancer diary. Anyway, back to the program. My kid was quite annoyed that I had started writing on my diary already before I finished threading it. And so when at the time I finished threading it all up, what I'd written ended up being halfway in the middle of the book.
Oh no.
Yeah, not happy with me.
It's fine.
Now it is. Took a while.
Alrighty, should we jump on in and smash
Yes.
this bugger out so that you
Let's
can
do it.
have the rest of the day to chill?
So, talking about the wonderful forays into Medicare.
Yes.
Did you... Just wait until they exit. See ya! Now I can do a cone. Yeah, it was very handy. It was very, very handy. Did you know
But did you know?
that Medicare was not our first attempt to provide some form of universal healthcare in Australia?
That is something I did not know.
There you go. Neither did I until I did research for this episode. So it will sound a little bit familiar once I remind you of it. Medicare first began its life as Medibank. Medibank is still a private insurance agency
Yep.
that you can still purchase insurance from. And even once Medicare was introduced, Medibank continued to be government operated for a while until the government sold it.
Yep.
Actually, sorry, no. Medibank was sold in part of the nationalisation and selling off our treasure. Medibank was one of the treasures that was sold off during that time. And then it was very quickly realised that there was a desperate need for a state-owned, state-run medical coverage system of some sort.
Yeah.
So we saw what happened in the US. It started happening here. And we went, better do something about that before everyone fucks.
The people are going to hang us.
Yeah. Yep. Telecom, Telstra, Medicare, Medibank. Yep. So this was Medibank was actually one of the reforms that Gough Whitlam tried to introduce in 75 he actually tried to introduce it, in 72. But it was one of those bills that had resulted in a bit of a schism within the Senate, trying to get the spending bill passed to get Medibank through. Because despite the recognition of how badly it was needed, didn't make it easy to get it funded.
No.
No, of course not. Why would it?
You know, it's people's lives versus money. And we all know what's most important.
Of course. Not.
Apparently.
Not what you want it to be, unfortunately. Hang on, where's my other window? Oh, there it is. Got it.
I've been giggling. I have to point it out because I've been giggling. I know it was a typo, or I'm pretty sure it was a typo from Callie. But my mum still calls Medibank Malady Bank. It's like Malady Bank. It's just been making me chuckle to myself this whole time.
Oh my gosh, I didn't even realise.
Just Malady Bank. Yep, you've had a malady, go to the Malady Bank. They'll look after you.
Oh my gosh.
Sorry to interrupt.
No. I'm going to do my cone now while we're paused.
Yeah, please do. I had to point it out because it was just my brain was just going, haha, Malady Bank.
I thought you were talking about I accidentally called it the struggle or socialised healthcare.
Oh, no, I haven't even seen that. Lily, that is very accurate. Calling Centrelink clink because it's like a prison of a system. Locks you in.
Yeah.
100% accurate. Your foster mother was spitting bars with that one.
Mm-hmm. I'm just trying to mute myself on this side because it's... Can I just... How do I turn you down without turning... Nope.
Am I too loud?
No, not you.
Oh,
me.
I see. Understood.
Me, you. Well, I have to...
Well, since we discussed your cleaning tactics this morning, Lily, then yeah, fair enough. I might wind that back just a tiny little bit, but just a little bit.
What? I missed all of that. What happened?
Outside of chat conversation, I was I was giving Lily's foster mum credit for calling Centrelink clink.
Oh,
because
yeah.
I think that's quite clever. And Lily mentioned that they also gave Lily their cleaning habits, so pull back the praise.
Just a little, throttle it just a little bit. Now, one of the reasons that Medibank was so tightly fought, or should I say so hotly contested, was over how it was going to be funded. So eventually funding was secured through a 2.5% income levy. What is always frustrating, there's sort of there's a couple of different ways that the governments can accrue tax. Just to give a really short tax rundown. Some of them are more even than others. So income levies are probably more even, it's sort of spread evenly across the population, more so than, say, goods and services tax. Goods and services taxes tend to be felt more by people who are in lower socioeconomic areas more than they are felt by people who are in the higher stratosphere of socioeconomic spheres. So the income levy was imposed to fund Medicare that was eventually decided on was 2.5%. It is always frustrating that the income levy seems to be the way that we decide to do these taxes when wealth tax is right there. But no one wants to touch that. Anyway. So Medibank was restricted by the 1980s when it was sold off, when it was privatised. By that point, the Australian government had only provided funding through Medibank to the lowest income Australians, those who were on pensions, which today people who are on pensions do receive additional medical support. So, for example, if you are someone who is on a pensioner card and you go in to receive healthcare, you won't have to pay the gap up front. The gap will be, covered for you until, by the government. So you don't have to wait for Medicare to doesn't mean that you don't have to pay if there is a fee there, but the gap is sort of, you don't have to wait for the money to come back, which is handy to have. Not in all situations either. If you go private, then they have their own systems, but it just, within the public system, there are some benefits to it. But when Medibank was around, they were the only sort of people who were being covered, like pensioners, low-income households. It was a very ramshackle system, and a lot of Australians were relying on private health insurance to cover their health needs. And because of how difficult it was to get affordable healthcare, a lot of Australians just didn't get any sort of health coverage at all. And this left a lot of people in the same sort of situation we see in the US, where people are literally going into bankruptcy because of health-related costs that they can't afford to pay out of pocket. And the Australian government wanted to stop this. We didn't have the runaway system they have over there with price gouging. It didn't mean that healthcare was cheap for people. Like $5,000 for, cancer surgery, cancer treatment is a lot for people to pay out of pocket. That's about what the average cost is through Medicare. That's not US prices, but it's still a lot for most people to be able to afford, So it's not nothing. Now, that is one of the other benefits of Medicare that we do have, is even though there might be, there might be gaps and things that we have to pay, because so much of it is regulated, it does ensure that prices stay lower, which is one of the other benefits of Medicare that was something that was being exploited a little bit throughout this time. And it was one of the reasons that when the government then in the the mid-80s, said that they wanted to introduce Medicare. So it was in 83 that they started talking about Medicare. When they said in 1983, when they were in opposition, the Labor government said that they were going to bring in Medicare if they won the next election, the Hawke government, there was a lot of outcry from doctors' offices and things as well, because they had been in this period where they were able to charge people a little bit more. They were able to gouge certain patients because there wasn't as much regulation over the industry. So there was a lot of pushback to Medicare, not just from the then opposition party being the Liberal government by the time they lost the next election. When Bob Hawke said that the new Medicare program will mean that 9 out of 10 Australians will pay less for their health needs of themselves and their families. And this is one of the primary motivators, was that reduction in costs, even for those people who were still going to have to pay something out of pocket. And this this new plan for universal healthcare, part of the reason that it was spoken out against was because people were enjoying the ability to be able to exploit people. Opposition leader John Howard in 1987 said that the government should have taken a knife to the expensive failed Medicare system. Medicare has added between $3 billion and $4 billion to the federal government. Medicare is one of the great failures of the Hawke government. It really seemed to miss Howard's perspective that if the government didn't pay that $4 billion, the Australian population was going to have to pay twice that much.
Yep.
So rather than looking at it as, hey, we've saved the Australian public $4 billion through this universal healthcare mechanism, he instead wanted to focus on what the outlay had been to the Australian government. And it's feeling very reminiscent of discussions about NDIS at the moment.
Yep. Beat me to the punch, buddy. Beat me to the punch.
I did have it noted down here. And NDIS, anyone?
Yeah. Having Medicare here constrains private health and constrains hospital charging, because Medicare tells hospitals what the maximum they will pay is. And because we have a public hospital system that has to abide by what Medicare charges or pays for procedures, the private health system knows that people can choose to abandon them and go to a decently, I'm not going to say well, but decently funded public system and utilize that. The primary reason that people use private is to avoid waiting times and to pick a doctor of their preference. That's the primary reasons.
Yeah.
It's not the quality.
No. And most of the time, for example, when you're going through cancer services, they'll advise you not to go private because there will be additional out-of-pocket expenses if you go private that you won't have if you go public. And you get the same treatment regardless, so they tell you not to bother.
Absolutely. Absolutely.
Yeah. It's just bizarre. And there are things like, there are some benefits that people might get with private health insurance. For example, there are things Medicare doesn't cover, like dental insurance, that might be worth people getting, particularly people who have like pre-existing conditions like diabetes, who are at what's that for?
On the dental insurance, big-ish. I've worked for a private health insurer, and dental insurance is not all it's cracked up to be, babes. They do not cover a lot of shit.
I was going to say, for people with pre-existing conditions like diabetes, though, because again, I don't have dental insurance. I don't bother because I don't have a pre-existing condition. I go to see the dentist when I need to, pay it out of pocket. But the amount of money that, like, for example, my ex has had to pay since I've known him in dental, like what the insurance has paid out for his dental was more than the deposit for this house has been.
Yeah, fair enough.
Because for someone with a condition like diabetes that has what's it called? It has an atrophying effect on the whole body, but it like rots your skin, it rots your teeth, your body's inability to process the sugar properly causes your body to basically rot away. I remember our first weekend away, he cracked his tooth clean in half on a fork. And we had to go to the emergency dentist, and it was like $3,000. And I was like, holy fucking shit. He's like, it's all right, insurance will cover it. I was like, what? So that's why I have dental insurance. This happens a lot. I was like, oh God. Okay. No worries. That was our first weekend away. Why did I marry this person? I don't know. Dental debt. I thought that's what I want. Sign me up for some of that dental debt.
That's what we need in our life.
That's what we need. But certainly for people who are under 16 years of age, with there being no gap for medical cover for public health care in most cases, that there's like you get payments and medical payments towards additional services and things as well, even ancillary services nowadays, which I know it's not easy to access all the time, but specifically if you are regional remote, there are issues within Medicare. Not saying there isn't. Definitely not saying there isn't.
Yep.
However, we are also talking to an international audience who is going to have a very different frame of reference, being
True.
they don't have any medical care.
That is a fair and valid point.
So, really hard to balance how shit our system is and how more shit everyone else has it.
Yeah, look, I can't really argue with that.
Sorry.
You're all right, buddy.
Every time I say something good about it, I'm reminded about something shit, and then I'm reminded that I'm talking to an audience including people who literally shoot healthcare CEOs. It's like, okay, could be worse, could be better, could be worse. Anyway, so. Back to what I was saying. I keep going all over the place with this shit. I'm so sorry.
You're all right.
So, in 1983, the Australian government moved quickly to establish Medicare as the sort of follow-on from what had been Medibank. And again, Medibank was sort of a half-hearted attempt at Medicare. It didn't in any way, shape or form provide anything like universal healthcare. But it did very much provide discounted healthcare. But by that point, it had been restricted to the point that it was providing not much of anything at all. Now, by the time Medicare began, more than 14 million Australians, or 92% of the population at the time, signed up to it. The Australian government had issued 6.5 million Medicare cards, remembering that one card goes to per family, but every individual member of the family has to sign up. Medicare restored bulk billing, which had been dismantled with the privatisation of Medibank. People could see a doctor free of charge. Public hospital treatment became free again. People would no longer miss out on public health. Fucking hell, Tamara, if you could just work out how to speak, that would be great. People no longer had to miss out on healthcare because they couldn't afford it. And this had been a perspective that many people at that time felt that, healthcare was a right. Especially as well, remembering that while this is like 80 years ago for us, 100 years ago for them, it was quite normal to get healthcare from like the community. We're talking distances of time out, the time frame that we have expands to such a rate that, we forget when democracy was first founded in the US, it was because they just figured out how to take away people's land and they were like, don't let that back.
Yeah, you've got a bit of an echo going on, Tam, just so you know.
Oh, do I? Shit, hang on.
Just a little bit.
All right, how's that?
Better. Go on.
Better?
Yeah,
all right.
Go on.
Perfect. Okay. Yeah, just because they eat shit doesn't mean we should be okay with drinking piss. Very true, Dom. Very, very true.
Bars, Dom. Goddamn.
Absolutely. And I think that is very important to remember as well for our audience. Just because you guys have to eat shit doesn't mean that we should be okay with having to drink piss. So we can talk about both the good and bad parts of the system.
Yep.
And personal perspective is going to have a lot to do with this. So I have had some really bad experiences with personal healthcare, including the fact that, I had to go through a mental health care treatment plan before someone would agree to put me on the wait list to have my bowel looked at, because maybe it wasn't all in my head that I was the weight loss and the constant bowel issues. Yeah. I am
precluded from having my abdominal wall repaired because apparently having a perforated abdominal wall that makes the join between the two sets of muscles look like a perforated sheet of paper. Apparently that can be cured by being not fat. Apparently. It's just going to repair itself if I stop being fat. So my choice is either live with it or sign up to have half of your fucking stomach cut out. And you've got no choice either side of that because your joints don't work, so you can't exercise properly.
I'm sorry, but in what universe is there a special like like, is there a special gene or something or enzyme that people get when they stop being fat that magically cure? Can someone tell me why it was that when I lost all the weight, I got the breast cancer then?
Yeah, right?
Because when I was fat, I didn't have breast cancer. I lost all the weight, suddenly I've got breast cancer. I'm just saying. You're finding correlations, I'm finding correlations. Who's to say who's right?
Yeah, exactly, man.
Thinness causes breast cancer. Being fat causes stomach perforations.
Yeah.
Both are scientifically valid propositions.
Yep, apparently. Holy shit. Wait. Hang on. I've just got the perfect solution to all of my problems.
Please share. Please share.
If I get thin, my abdominal wall will heal itself. Then I will get booby cancer and I can get a double mastectomy on the government.
Oh my God. And that's what I did.
Shit.
That's what I did. So my ex-husband cheated on me so that I could get so stressed that I could lose all of the weight, so that I could get breast cancer, so that I could get the hysterectomy that I asked for before he cheated on me.
Right.
And they told me I couldn't get it.
The roundabout things that we have to do to make this system work for us, I swear to God.
Just a little bit of breast cancer. Breast cancer is your friend, actually. It shouldn't be a fight against breast cancer. We should be fighting
opens
with
so many
breast
doors.
cancer. It really does. You two goobers. Yeah.
Yeah, well, my tits are broken, so you have to listen to me.
Yeah, my tits are trying to kill me, so, yeah.
My nips are assassin's rifles pointed
Monique.
directly at me.
Monique the Mass and her minions. Monique the Mass and her fucking minions. And I tell you what I've also discovered. I've discovered, and I already knew it, but I keep forgetting it because I did work this out last time. Well, I am allergic to latex.
Yes.
And I have to keep forgetting to tell them that.
What do you mean you have to keep forgetting to tell them that?
I have to remember. I have to stop forgetting. I keep forgetting, and I need to stop doing that.
Nitrile gloves only.
When I go in there, it's just to say, please, can someone put on my file because I keep forgetting that I don't want the latex. Oh, I'm so itchy. Oh.
Yes, Ed, we are goobers. This is how we cope with life, by being complete and utter goblins. This is the only way we can deal with it.
It's my process. It's my process.
It's your creative process.
Yes, I have to put this closer to my face.
Okay.
That way I'll stop leaning forward, and the sun also I won't be in shadow. Win-win.
That's actually a good idea.
Sorry. Move it right up next to me and then cough right into it. That's great.
Oh, yeah. The best.
The worst if my brain stopped. Yep, absolutely. Brain fog is the fucking worst. I'm so glad. Can I tell you how relieved? I cannot tell you how relieved that I am that it's just breast cancer and it's not long COVID. And please, someone clip that and spread it far and wide because people need to be more aware of how bad COVID is.
Oh, I'm so in agreement. I'm so in agreement. I'm so glad that you're the one saying it and I'm not, because holy shit, if I
the
said
person
long
with
COVID
breast
is worse than
cancer. I'm so glad when my doctor said, I went, it's long COVID, isn't it? And she goes, it's breast cancer. And I went, oh. She goes, I know it's a shock. And I said, it's a relief. What are you talking about?
Oh my God.
God almighty. You're telling me we can cut her out and she will be gone? Oh!
I can just vivisect the bitch.
Vivisect that bitch. Radiate her friends. Yeah.
Yeah, exactly, Lily.
Yeah.
This is
And
just
part
your
of-
reality now.
Part of my doctor's concern for me when I had that reaction was you do realise that cancer is going to have an adaptation as well. And I looked at her and I went, yes, again, I'm not expecting to have the energy of a 20-year-old, a sprightly 20-year-old again. I'm aware that I'm a 37-year-old with cancer, but I'm not a 37-year-old with long COVID.
I do not want the energy of me when I was 20. My body is too broken to handle that much drive.
See, I've got kids. I just
fall
want it.
apart, mate.
I just want it from like 4 p.m. until 8 p.m. every night. That's all. Just for that period of time. And then
you meant energy. You want energy from 4 till... right, misunderstood. Never mind, I'll stop mulging at the camera. Don't mind me.
I'll steal your energy. I'll vampire energy. I'm
Fucking
trying to
do
find
it, I
this
double dare ya.
page. I'm trying to find this page that I wrote that's like literally halfway in this book now. But anyway, back to what I was saying about Medicare.
Yeah.
So, now, Medicare has paid over $488 billion in benefits since it was introduced in 1984, and these stats are as of 2023. So there's been more since then, no doubt. In its first financial year, it cut, oh my God, fuck this brain of mine. Cancer brain, fucking tell you what. In its first financial year, Medicare cost... Healthcare costs of healthcare were cut.
There you go.
So much that it also cut inflation. What a shocker. Government spending. It turns out government spending reduces inflation. It's really weird. It's really weird. It's weird. And then people so that people go, yeah, we should run the government like a business. And then you go, but when businesses spend money, inflation goes up, and we try and stop that with high interest rates.
Uh-huh.
So what are you talking about? You crazy motherfuckers.
Yeah. Who would have thought that the government taking the pressure off of the civilian population would reduce inflationary pressures?
Who would have thought? What a shock.
That could have happened.
What a shock.
Well,
and it's
like
so strange.
Every economist ever knew it. It's just because economists are finance bros by default, they refuse to acknowledge it.
Yeah. It's really strange too how when I keep pointing out to people, because people go, housing isn't like... People, I often think to myself that it's a communication disability issue in me, because I do have a communication disability. But then I remember that, but also other people are morons, and it might just be that, because I point out that interest rates go up as a way of trying to drive down inflation, but as a part of the cost of inflation, we calculate rent. Mm-hmm. And because so many people have over-leveraged mortgages, when the interest rates go up, they put rents of people up. So increasing interest rates was having an effect, especially since we'd flipped. Our economy has flipped from having like 80% ownership, which it used to have back in the day, to now having 40% ownership. Our economy has flipped. So now we have more people renting. And so interest rates go up, rents go up, inflation goes up. So interest rate goes up, and then rent goes up. So inflation goes up. And so this is rent pushed inflation, and people go, but housing costs aren't calculated as a part of the inflation basket. And I'm like, no, mortgages aren't.
Yep.
But mortgages don't make up the majority of housing anymore.
Yeah,
so you can't
mortgages
say...
are condensed and consolidated into a much smaller amount of people than the majority of people who are renting.
Yeah, the majority of housing is not made up by homeowners anymore. So you can no longer say that housing isn't part of the basket, because the vast majority of housing now is part of that basket. Yes. And so when you increase inflation, and it increases housing costs, and then it increases inflation because you increase the interest rates, which increase the housing costs.
Yep.
Oh, wow.
You create a self-fulfilling cycle.
Oh, and it's just ridiculous.
Yeah.
It's just absolutely, and it's just ridiculous watching people go around in circles.
The stupidest thing about the whole, like, interest rates to drive down inflation is we know that this inflationary pressure is driven by private enterprise price gouging customers, driving up prices using things like COVID and Ukraine to justify their price increases.
Yeah.
And they've got... that's what's the primary cause. And then...
And everyone I just also want to point out what really pissed me off about this was we pointed this out during the time too. We kept pointing out they keep blaming all these issues for why they have to increase prices, but they're also posting record profits. And then people would go, are they not allowed to why are they not allowed to make profit? It's like, how can they be complaining about increased costs while also posting record profits and have it not be price gouging consumers when the prices are increasing?
Yep.
How? And I think that it's a communication disability that people aren't getting this link. And it's like, am I an idiot or are you?
No, see, here's the thing. It's not that you're not communicating the information properly. The issue comes from people being unwilling to let go of what they see as how the world works.
Yeah.
People are so entrenched in their worldview that any information that runs counter to that creates cognitive dissonance.
They're so blind.
People with a neurotypical brain deal with cognitive dissonance in one of two ways. Either they completely reject it and substitute it with their own version of reality, or they actually listen and start to understand the problems that are faced. Now, the unfortunate part is because we've been because we've been being pushed towards a more individualistic society, people are less willing to open their brains and consider another opinion than they are to find something to reinforce their own previously held beliefs and avoid the cognitive dissonance entirely.
I don't understand. It feels as well like people are looking for people to disagree with rather than, do you know what I mean? Like it feels like they're looking for your content, not to learn from your perspective or what you've got to say based on your education, but so that they can argue their own feelings.
Yeah, it's just so that they can reinforce for themselves what they believe. Like, I had somebody come in to a video that I made about 10-year-olds being able to be locked up on TikTok, right?
Yeah.
And somebody came in and went, no, but have you seen the increase in youth crime?
Oh my gosh.
I'm like, okay, so please provide me with literally any statistic from a reputable source that shows that youth crime has increased markedly in the last decade, and I will shut up and delete every account I have from the internet.
Also,
and she blocked me.
I was going to say, also, even if there was a marked increase in youth crime, show me any evidence, any evidence, that police intervention helps to in any way reduce recidivism or youth crime in any way, shape or form. Because I can show you plenty of evidence to the contrary.
Yep. My TikTok comments aren't long enough to phrase that, so I just did the easier one.
This is why I like doing video replies.
Oh, yeah.
This is why I like my video replies.
I really should start doing that, honestly. It's free content.
People constantly turn around and say to me, so many of your videos are just you responding to comments. I'm like, why wouldn't it be? I'm talking to people about how stupid their opinions are. My job is to tell them how stupid they are. This is the easiest way to do it. It's great.
Yep, that's fair.
Because most of the time it is literally just explaining to people. Like, the thing that always blows people out, because people go, what, are we supposed to just let children who murder roam the streets? And I was just like, no. But because we spend so much time locking up children who are shoplifting lollies from Woolies on dares from their friends, who then don't get jobs and get looked down upon to society and get, have further issues as they get older and when you look at the crime statistics, this is one of the most difficult things is when you actually get involved in criminology and you learn about it, you begin to understand the way all of this information relates. It's really hard to put it into a nice little soundbite. So one of the easiest ways I can explain it is people grow out of crime. What we know is that without a doubt, if we leave people alone, they tend to grow out of it. People tend to, as their brains develop, as their frontal lobe develops and they begin to understand consequences, they begin to understand they shouldn't do stupid shit, and they stop doing it. And the people who don't get picked up by the cops grow up to think that they're not criminals because they were never labelled a criminal by the system, instead of recognising that they did the same behaviour. Like, I remember sitting in a class with this group of kids saying, hands up who's never, ever, ever committed a crime in your entire life. And like half of them shoot their hands up like, yep, holier than thou. And I said, okay, which one of you, okay, keep your hand up if you didn't take a drink on schoolies. And all their hands went down. And I said, yeah, not a single fucking one of you was old enough to drink, but you all took a drink at schoolies, on public land, or at someone's house where you weren't supposed to be drinking. Not like none of, I guarantee you, none of you gave a shit about the drinking laws and what those regulations were. Every one of you would be considered a criminal, because that is what my dad got done for, and he still has a criminal record.
Yep.
And they all look at you and you're just like, yeah, he walks around with an expunged criminal record for doing the same fucking thing that you guys all sit there and go, I'm not a criminal because I didn't do X, Y, and Z. And the look on their faces like, well, that doesn't matter. It's like, you are the exact fucking same. You just think that you're better because of the colour of your skin and the amount of money in your bank account and because of where you went for schoolies. Yep. Like, absolutely. Absolutely. It's developmentally appropriate to push boundaries, and unfortunately 100%. children who have police intervention as a result of those boundaries getting pushed are more likely to have police intervention later on in life, because the police start watching you as a known person once you've had police intervention. And so the same mistakes that other kids get to learn from, you're punished for. And people just don't get it. They don't understand how much we say that we want jail to be about, like, oh, you know, it's like people say constantly, oh, it's like a summer camp for those kids. It's like, okay. And can I just say right now, first of all, if you've watched the footage and you think it's a summer camp, I don't know how many kids die at summer camp, but usually they're not allowed to keep those summer camps open.
Yeah. Yep.
Look up Section 18 in WA if you don't know what I'm talking about. Anyway, so if kids died at summer camp, they wouldn't be allowed to keep the summer camp open for starters. Second of all, kids shouldn't be at summer camp for half the fucking year. They need to be in school. They need to be in their regular environment. They need to be with their community. They need to be... And the problem with these short sentences is that they don't get... People go, oh, they go to school and stuff in there. No, they don't. If they're in for these short sentences, which they do, most of them get in there for these short 6-month stints, in and out, in and out, in and out, for petty theft.
Yep.
They don't get intervention programs. They don't get hooked up with school. They don't get hooked up with counselling. They don't get hooked up with services. They're just in and out. Right. They're in there waiting for their court date. And then they get
removed from community. They are removed from school access. They are removed from friendship groups. They are removed from support networks. They are stuck in a hostile environment with people that they don't know, having to be constantly vigilant and aware of their surroundings so that nothing can happen to them. And they receive no support while they're in there. And then when they come out after 6 months, they're told, now behave or it'll happen again.
Yeah. And they get no support when they come out because they weren't in there long enough to get the supports on their way out either. I was also going to say, I did make a video on this while I was making it, as part of my new series that I'm doing called Crafting Through Cancer. So I'm going to post that. That's going to be posted on TikTok starting tonight.
Nice.
My new series, Crafting Through Cancer. Join me during my morbid... set their nervous system on fire and then tell them to behave themselves.
Yeah.
That's going to go so well.
Exactly. And I do want to go back to, like, the first thing that you said that kicked off this sort of tangent. Yeah. People saying, what are we supposed to do? Leave them to roam the streets. Let's have a think about that question for a moment. The very end of it, leave them to roam the streets. Could that not be the inciting problem?
Yeah.
That there isn't enough government supports for these children who are turning
for their communities.
To crime predominantly to look after themselves.
Yeah. Yeah.
Because they do not have access to the finances, the supports, the government programs.
Because they're hungry. Anything. Most of the time they're fucking hungry. There's no food at home and they're out looking for food. Yep. That is like what 90%.
Or something they can sell for food.
literally 90% of the kids who first intervention, they get asked, what the fuck are you doing there? They're like looking for something to eat.
Yep. Yep.
And then
And
it's
instead
just...
of taking a community-minded viewpoint on it and going, oh, okay, so things at home are hard, let's have a look and see if there's some resources that can help you
Yeah.
out. Instead of doing that, we're doing the old English method of arrest them, throw them on a ship and send them to Australia.
Kill them, actually. We're trying to get to the point where we're just allowed to kill them on site.
Yeah.
We're working up to it.
Yeah, building our way.
Building our way towards it. Sorry, this might be triggering for some viewers. So
Yeah.
that can be a nice end to our episode we started a while back on Banksia Hill and Section 18 that I forgot to finish in the end. So
Yep,
there you
that'll
go.
work.
That'll work as a nice end to that episode. And now back to what we're talking about with Medicare.
You can just cut the ending spiel and just attach it to that one.
Yeah. We already did an ending spiel for that one too.
Oh,
I
we
can
did. That's right.
Yeah, but I just hadn't. We were like, we'll finish it next time.
Yeah, we'll get round to it.
Yeah, and we always do. We always do. So, So, hospital and medical expenses were one of the largest reasons for personal and non-business related bankruptcy before Medicare was introduced. After Medicare, they actually removed it from the published list of reasons because it fell so low. So medical expenses are no longer listed as one of the majority main reasons people declare bankruptcy. There are still cases where it does happen, particularly around dental care and dental work in Australia. There have been, if you have a look on reasons that people go bankrupt, dental care is actually in its own category because it trumps other forms of medical debt as a reason that people go bankrupt in Australia. But there you go. Interestingly. So because Medicare's introduction was not smooth sailing, we shouldn't be surprised that it still is under threat today. Let's be honest. Medicare is now widely considered to be one of the greatest social achievements that we have ever accomplished as a country. However, that doesn't mean there haven't been attempts to diminish its power within the country. For example, we know that copay contributions as well as the constant removal of certain procedures from Medicare is a constant ongoing process. About 10 years ago, pap smears were one of the
Procedures.
as it was considered preemptive medical care. It was removed from medical care from Medicare, and thanks to some strong advocacy on behalf of women's healthcare groups, it was re-added back to Medicare again. Unfortunately, this isn't always the case for other procedures that can be removed from Medicare with nary a whisper from the community if there isn't, enough of
enough outcry.
and enough people affected by it. So, for example, one of the medical conditions that a member of my family has, the medication for it isn't covered by the pharmaceutical benefit scheme because there's only about a dozen people in the country who would need this medication, and most of them are over 80 and have decided just to put up with maybe getting a kidney stone every 10 years rather than taking a medicine every day. Now, my 8-year-old doesn't have that option. They're going to need this medication throughout their entire lives, and because it's not covered by the PBS, it would be extremely expensive out of pocket, as I would have to pay full price for the medication, as the label said, from the supplier based in America, and what they say is it's $130 or something from like 80 days worth.
Yep.
Now, I am also able to, use other means of managing their healthcare, so it's not all down to the medication. So, it's whatever. It's not as bad as people who, for example, have diabetes and it's life or death if they don't get access to their medication.
Yeah.
But it can be very expensive. But in saying that, the hospital make and supply our medication so that it's a hospital supply of medication so that they can still charge us the Medicare rebate rate of $7.60 for a prescription. Because our medical staff, and Medicare is so ingrained and so beloved by the medical staff and the medical system, they're often the ones who fight the hardest for the system.
Yeah.
And unfortunately, strengthening Medicare has been met by some really big challenges in our day and age, and I wanted to talk about a couple of them really quickly, and I know that you're going to have some comments on it. So one of them is increasing bulk billing incentives. So GPs, as we know, there's a lot of GPs who simply aren't taking on more clients. GPs insist on booking only 45-minute appointments with people, even if you just want to go in there and get a script refill. They, won't take just a 15-minute appointment anymore. A lot of GPs, you have to wait weeks to get an appointment. It was one of the things that I found the most frustrating about my situation, because in order for me to get seen as quickly as I did and get everything sorted, as I didn't see my GP until after I got my diagnosis. I was able to tell my GP what my diagnosis was because I had to go to an emergency after hours GP because I couldn't get in to see my GP. The appointment I tried to book with her when I first found the lump is coming up this Wednesday. I kept the appointment because I was like, I'm sure we'll have something to talk about by then, and we do. So there you go.
Yep.
So the appointment I tried to book with her when I first found the lump is coming up this Tuesday. And since then, I've had a barrage of tests and things done that she has ordered. But that's because I went into the after hours GP, said, I found a lump, I want a scan. The after hours GP ordered the ultrasound, which very clearly showed Monique mastitis. Not mastitis, sorry. I keep going. Maybe she's a mastitis. She's not. Monique the mass.
Yes.
Monique the messy mass, the cancerous mass.
That bitch.
Yeah. And then after she showed up and after we got the report saying that she had like tick, 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 all the little ticks that said she was cancerous, she was a carcinoma, that's when my GP called me and said, come in and see me for an emergency appointment. My GP made an appointment for me to go in and see her. So I've been going and seeing my GP because my GP is making appointments for me to go and see her. I can't go in online and book an appointment with her. I can't call up and book an appointment. She is booked out weeks, months in advance. And so it makes it really difficult because one of the things they keep talking about is GPs is so much difficult with access to GPs, but one of the other big issues that Medicare has, this leads on to the second issue, which is supporting a more team-based, multidisciplinary primary care approach, meaning that you can go to your GP who's able to send you out to specialists, and then you can come back to your GP to talk about your healthcare and, talk about all of the results and things and, still have your primary physician be your family GP.
Yes.
But in the year of our Lord 2025, asking someone who their GP is like asking where they park their fucking Cadillac. What the fuck are you talking about? I caught the bus here and then I had to walk half the way because they've stopped the bus from coming every 2 hours. Now it only comes 3 times a day. The last bus finishes at 1:30, so I had to walk the rest of the fucking way and I'm going to have to walk home after this. What are you fucking talking about?
Yep.
So, unfortunately, while we need to have a more team-based multidisciplinary primary care approach, especially because it's so difficult to get in and see specialists, and to be able to get updates on what the next step in our care would be, having a primary care physician is what you really need. You need someone who you can go back to, who can update you on your health and where you're at in the process. But we don't have that approach because we don't have the funding to support going and seeing the GP. It's like providing a more connected healthcare experience is the next one so that both patients, GPs, and the multidisciplinary care teams are all more connected.
Yep.
But again, we can't get in to see them.
Yeah. Like, it's pointless even discussing the idea of having that multi-connected discipline if the first hurdle isn't being cleared. Like, if at the very first step you fall flat on your face, why are we talking about the second step? We need to get you taking your first one.
Yeah.
And the first one is ensuring that people have access to a GP.
Yeah,
now, I am lucky enough to have been seeing my GP for well over a decade now. I'm very lucky and very privileged to have that option. He knows me inside and out. He knows all of my health concerns. And he knows that if I come to him with a problem, he should take me seriously because I don't often come to him.
Yeah.
Like, when I came to him and said, I need to go in for an ADHD assessment, he was like, right, okay, definitely, let me get you a referral immediately.
Yeah,
Like,
easy.
there was no questions asked. It was just, let's do it.
Good God, can you imagine being taken seriously? That would just be amazing. That would just be amazing. My frustrating thing is that I went in to the after hours GP, right? And I went in with one breast mass. And then on the referral form, the after hours GP wrote that there were 2 breast masses, but that she couldn't feel them. And I went, okay. And so then when I went in for the ultrasound, I was getting pushback about that. And then they saw it and they were like, oh no, we should stop with that. Then I had to go back in for another procedure and I got pushed back. And it was just like, I mean, don't get me wrong. The speed at which everything has happened has been great. But every single step of the way, it's like everyone kept asking why they had to do their job.
Yeah. And it's because, I'll tell you why. It's because that very first written thing cast doubt upon the entire thing.
Yeah.
And everybody reads that first thing and now doubts it.
Yeah. Yeah.
And it's... Okay, so... I've told this story before, I'm pretty sure.
Yeah.
But about 12 years ago now, my appendix ruptured.
Yeah.
And it killed me. I literally...
Died
my
on the
heart
operating
stopped
table.
2 times. Like,
Yeah.
once on the operating table, once a week later when my body went into septic shock. But in the lead up to it, I was experiencing abdominal pain and constipation. And I went into the doctor and I talked to him about it. This wasn't my doctor at the time. This is a doctor that I switched from to my doctor.
Yeah.
And I went into the doctor beforehand and I was like, look, this is what I'm experiencing. This is where the pain is located. This is what's going on. I need to know what's happening. And he went, oh, it's just constipation. You've probably pulled a muscle. Maybe try losing weight about it. 2 days later, I was in emergency being pushed to the top of the list because my bowel had ruptured and was leaking everything into my abdominal cavity.
Yeah.
I had a heart rate of 200 and an internal body temperature of 41.8.
Yeah.
And I was being rushed into surgery immediately. When I got out of hospital 4 months later, I booked an appointment with that doctor and took my hospital discharge files.
Yeah, just go, see what happened? See, the day I was admitted was the day you told me.
Yeah, 2
the
days
day
after.
You told me I was being a
And
suki lala.
I put the discharge files on his desk and I said, read them.
Yeah.
And he sat there and he read them and I watched his face go white.
Yeah.
And I'm like, I am well within my rights to fucking sue you. Mm-hmm. But I'm not going to because I want this to be a learning lesson for you.
Sometimes I wish we just did sue them, though, because they shouldn't be doctors
I wish I
anymore.
had. I'd be much better off now.
And that's like, and you also just think you shouldn't be a doctor anymore. You know,
Yeah,
that's
right.
just. It doesn't seem like the profession for you, motherfucker.
I did report him.
Yeah,
Like I did report him to the medical association.
I reported the midwife who sexually assaulted me during an examination.
Jesus fuck.
Yeah. They
But,
told me they told me that they didn't think, they thought that sexual assault was too strong a term, and I said, what do you call it if there's vaginal penetration without consent? I mean,
Fucking Christ alive.
I don't know what else to call it.
Yeah, no, you're calling it the right thing, mate. But yeah, I went in with the paperwork and I was like, this is something you need to be aware of. You need to start taking your patients more seriously. And if you ever look at an overweight patient again and say, maybe try losing weight about it, I hope you look in the mirror and just punch yourself right in the fucking face as hard as you can.
Absolutely.
Because that attitude will kill people.
Yeah. Yeah,
And
that's a
like,
good one, Zab. Yep, doctors without empathy. Absolutely.
yep, absolutely. But that leads into like the bigger point that I was trying to make with going on that tangent. I apologize. It
Yeah.
kind of went
No,
off
no,
a little
you're
bit.
good. Tangents work.
The bigger point that I was trying to make was even when you can get in to see a doctor,
Yeah.
if there is anything visually that they can look at and go, that's the cause of all of your problems, you're not getting assistance anyway.
This is what frustrates me. I say constantly, if I could diagnose it by looking in the mirror, why would I be in here? I can also read for 8 years straight, especially if all I'm doing is reading about my symptoms and my life and changing things and testing things on me. I can work out what's wrong with me. I need you to organize the blood tests because turns out I may also not just have Crohn's, I may actually be celiacs, which you can test with a simple blood test.
Yep.
But I had to prove that I wasn't just having constant bowel pain from anxiety first.
Yep.
Even though they can diagnose celiacs with a simple blood
With a blood
test.
test. Yeah. Yeah. It's ridiculous.
Ah. And when I went in and saw the bowel cancer specialist, the bowel specialist, the endoscopy clinic, I said to her, yeah, a couple of things I noticed were triggering it. And I told her, and I said, and one of them is honey. And she said, honey. And I said, well, I'm assuming it's honey because it only happens late at night when I've had tea. And the only thing I have in my tea, it's like flavored water with honey in it. The only thing I can think of is honey. And she's like, yeah, okay, rightio, honey, interesting. And then she immediately goes, well, you're going to have to start eating bread again because I'm pretty sure you've got celiacs. But before we do the blood test, you have to have been eating grain for 6 weeks.
Yep.
So it's usually like we say to GPs, why did you fucking test for this? I'm like, why didn't she? And the doctor's like, I don't know.
Yep, exactly.
Because it's also one of the first things that people start cutting out when they realize they've got gut issues. They're like, I'll cut out wheat. Oh, that helps. I'll stop eating that. Then we have to be like, please start again.
Yep, please start again for 6 weeks. But Lily, you mentioned, or if you're a woman, is the other thing that gets you dismissed.
Yeah.
I 100% agree with that. Like the amount
100%.
of my femme friends that I have gone into doctor's surgeries and pretended to be their partner so that I can go into the the doctor's office with them and advocate on their behalf because they aren't getting listened to. Like the amount of times that I've gone in and the doctor seeing me there has now started fucking paying attention to them. And if they don't, having me go, hey, don't fucking start. Because I'm big and I'm mean and I'm fucking angry looking. Like,
I think a lot of the time as well. Oh, I just found the praying mantis. There it is. I have to take him outside before he dies in here. Sorry, he was on the plant and then he disappeared and now I've just spotted him again. And there he is.
do you want to go do that now?
No, that's all right.
Okay.
I think the other, I mean, there's a lot of problems. There's so many different issues.
Oh,
But part of the other problem as well is I think because it takes, like, I know when I was having, like, I was like, by the time I finally got into see the GP, I had a list of 10 things I had to talk about. And so I'm in there with like my shopping list, like bang, 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 bang. And so my doctor's like bang, 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 bang. And so because it now feels so transactional like that, because I can only get in to see you every 2 months and I need to get blood tests done and I need to get my anxiety med prescription refilled and I need to get referral to the cardiologist because my heart's been playing up again and I fainted twice and so now I need to go and get that checked out and like so because I'm going in there with like bang 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 bang, it's like you don't get the same. So the really good thing about my GP is that I got an emergency appointment with her the morning that everything sort of happened. I got an emergency appointment with her, like a couple of years back I'm talking about. Mm-hmm. And I went in there off my nana and she gave me a couple of diazepam to calm me down and I went, oh God, that works a little bit too well. That works scary well. Okay, don't give me any more of that. And
Yeah.
ever since then, I just keep going back and seeing her. And so every time she sees me, she's like, oh, it's the crazy lady. So I kind of immediately get her attention every time.
Yeah.
She doesn't actually go, oh, it's the crazy lady. But I think I
good.
did make a really sterling, you know what I mean? Like I stood out in her mind. She's never going to forget me. So it's
First
immediately
impressions
attention.
were on point, hey?
Exactly. First impressions were on point. So every time she sees me, she's like, oh, that's right, you.
I recognise you.
I recognise you. So it does make it a little bit easier to get her attention. Yep, GP and Alice got us. I feel like they learn early on. I think I'm gonna just do another coin quickly and then we'll keep going.
Yep. No worries, mate. No worries.
Sorry. Because I need another one.
It is desperately sad that we have to, like, I'm looking at Zab's comment here, and it is desperately sad that this is something that we even have to do.
Yeah.
Like, the fact that the medical system is so just bollocked up. And, like, here's my real question, right?
Yeah.
Why the fuck are you a doctor if you don't give a shit about people?
Well, this is what I was going to say too. This
Why
is
keep doing it?
on the flip side of that. I've banned, like, even before we separated, I banned my ex from coming into medical appointments with me because his ADHD would set off and he would just start peppering the doctor with questions.
Yep.
And the doctor would just default to listening to the man in the room. And so I'd be sitting there going, this is my appointment. Why are you talking to him? Fucking over here, please. So I'm just like, no one else can be in my medical appointments with me at all
Fair
anymore
enough.
after that. And again,
Fair
it is
enough
very
as well.
personal, you know?
Yeah. Fully understand that. Like,
Yeah.
Some people prefer to go it alone and just want some advice as to how to be more assertive.
Oh, yeah, I don't have that
know?
problem. That's
Yeah, believe. I'm keenly aware.
my
You are
doctor.
plenty assertive, my love.
My doctor was bitching about having to take out my IUD while she was taking it out. Like, while she was taking it out, she was bitching about having to take it out. Because I was just like, well, it's in me and I want it out, so take it out. And I just got up on the bed and she started going, oh, it's just so well placed. And these are really hard to place, you know. And, like, I really don't see why we have to take it out. And I'm just sitting there with my legs in the stirrups going, rip her out. Rip her fucking out.
Pull the ripcord, babe. I'm ready.
Don't care. I swear she made it painful on purpose but I was just like, fucking bitch, I am in charge. My body, my choice. Get this bitch out of me.
Yeah.
Absolutely. Sorry, yelling. Ah. Yeah, before that, it was rare that a medicine person was called a doctor. I did actually know that the term doctor was first bestowed upon, like, the doctor of philosophy and a doctor of law and a doctor of, like, the real...
Yes, those of the learned.
Yeah, the learned doctors were the first doctors. They were the real doctors. And a medical doctor, MD, it was an honorary title. And you can actually only, like, I thought it was so weird because... my doctor has a master's of dermatology, and I found it really weird because, like, I have a master's. And I'm like, you have as much education about being a doctor as I do about political science. And I'm not, I don't know, people say that I should shut up and not give opinions on how to run the country. And I don't know. Feels like the vibes are weird.
I've got the same level of educational qualification as my doctor does to diagnose a malignant melanoma, then, I think maybe I have the qualities to talk about this.
I can identify malignancy in government the way my doctor can identify malignancy in the skin, bitches.
Oh, buzz. And this is what I say to people about this podcast when I explain this podcast. I'm like, you've got me, a random himbo with blue hair, tattoos and piercings, speaking to someone who has a fucking master's in political science, and for some reason they listen to the things that I say every now and then. It's really weird, and I don't know why this is happening to me, but it is, and I'm enjoying it.
The thing is, I feel woefully like whenever it comes to politics, people are like, "What is this and what is this?" This is like, I don't know. Your guess is as good as mine at this point. Like, shit is so fucked out there. Have you not been paying attention? Shit is so fucked. Like, honestly. When it comes to legal theory, I'm like, oh, that I can explain, because legal theory is all about what happened already. So that I can explain. But when you're talking about modern day politics, I'm like, ask me in 10 years about, like, ask me in 2035 and I'll tell you all about it.
Yeah, I'll tell you everything you need to know.
Yeah.
Whereas me, I have a horrifying case of future sight for politics. I have a horrifying case of I can see the future. And also Cassandra disease.
Yeah. I'm not going to lie,
no one fucking listens.
I'm not going to lie. That is, I found the clip the other night because I was looking for it actually for the podcast. We were talking about it when I was talking about when Biden announced he was going to run in 2020. And I said, no, like before he announced, and I said, no, I can tell he's going to announce. I'm so annoyed because if Biden announces, he's just guaranteed Trump is going to win in 2024. If Biden announces it's going to guarantee a Trump presidency, please don't. He's going to, I know he is, but please don't. And he announced, and I was like, fuck off. We're going to be saluting fucking Trump in 2024. We're going to be doing the goose step when Trump comes in. And next minute, I'm like, I literally have the clip of me saying we're going to be goose stepping into Trump in 2024. And then there's a fucking clip at Trump's inauguration of Elon doing the fucking Hitler salute. I'm like, oh God.
And, oh, fuck. Nope, I've got to calm down. Because I'm going to go off on a fucking tear that's going to last 25 goddamn minutes and you're not feeling great, so I need to stop myself.
It's just so transparent, though. Like, it's,
absolutely.
Do you know what I mean?
And like, no, you know what? Fuck it. It's happening.
All right, I'm going to do a code.
Yeah, please do. Feel free to mute me if you want while I just go on a fucking ramble because I have some shit to say. Fucking Elon, right?
Doug! Yeah.
Fucking dog shit piece of fucking crap.
Fucking cunt. Just say it.
Throws up two Sig Heils at Trump's inauguration on the fucking stage, one after another. And then half of the goddamn country tries to smoke screen it as he's doing a Roman salute, which, by the way, was where the Sig Heil came from. That's not a fucking protection.
I was going to say, the Roman salute is literally just a dog whistle for a Nazi salute, you dumb fucks. How stupid do you need to be? It's literally just a dog whistle for Sig Heil.
And then they say that he was doing My Heart Goes Out to You. And we found footage of him doing the actual heart thing and then sort of waving out to the crowd. He knows how to do that.
He does. He does. Not to mention,
we've got fucking video footage.
Not to mention all the people.
Goddamn autism.
All the people standing there going, "My heart goes out to you." I'm like, that's not what he did. Right? You cowardly cunt. That is not what he fucking did. Do it the same way. Don't be a pussy. Sig Heil. That's how it's done. None of this pussyfooting shit. It was straight fucking up there, 45-degree angle. Don't be a fucking coward. Put your back into it, you Nazi cunts.
Yep. Like, holy shit. For a country that has an entire fucking history based around the fact that they're the heroes of World War II who stopped Adolf Hitler in his tracks, despite the fact that
Operation
had
Paperclip.
nothing to do with Hitler. Like,
not to mention Operation Paperclip, they literally just went in, picked up all the scientists, imported them into the US. Why do you think Silicon Valley is full of Nazis? Where do you think all the Nazis went? Half of them went to Argentina and the other half went into the tech industry in America.
So isn't it funny that America's rocket program started with Nazis and looks like it's going to end with one too? Like, I am seeing fall of a civilization here. Like, I am
Can I
genuinely
just-
seeing the fall of a
Oh,
civilization.
absolutely. Because the worst part is, as well, as soon as he started talking about education during his campaign,
Yep.
I just started saying to everybody, remember how, and this is before, like, the US isn't at all, but Germany was before World War III, before Hitler took power, before the 1930s. In the 1920s, Germany had the best education system in the
Yep.
world. They were second to none. And then Hitler literally just walks in and changes the whole curriculum because he doesn't want them teaching woke theory. And then got them to change the whole language to make sure that they couldn't read any of the old textbooks that said all the old shit. Don't give Hitler any ideas. Sorry, that was a Freudian slip. Don't give Trump any ideas. But he literally changed the language. They couldn't read the old textbooks because he was so fucking pathetic. And then they became the worst educated masses in the whole world. And he blamed the woke agenda that he literally deleted from the books. And then fucking changed the language so they couldn't even read old documents. And then went, why can none of these motherfuckers read?
Yep. I can't fucking handle it. Hey, like it's so transparently bullshit.
People act like the Nazis weren't ridiculous as well as they were evil the first time around.
Yeah.
Like, he changed the language because, are you fucking kidding?
Yep.
He was just as fucking bizarre as Trump.
Yeah, exactly. And like the amount of people who seem to believe that fascism happens all in one great big leap and not by an order of small magnitudes that happen one after another, and you can literally follow the trail because it has been written about. Trump is following the Nazi playbook. He is following the exact same thing. He is following the exact same thing that the Third Reich did to establish itself.
100%.
He has taken, copy-pasted directly into history. We're just 10 years early to be on a 100-year cycle.
Yeah.
It is fucking happening again.
Yeah.
And as a student of history and somebody who can look at current events and see where things are going, I am telling you right now, this shit is happening again.
Do you know what it reminds me of as well? It reminds me of the story. This is going to sound, I promise you, this is just from my Bible waving days, this story. It reminds me of the story of when the Jesus had warned the population in Jerusalem that they were going to be encircled by Romans, and then the Romans were going to leave and they were going to have a little bit of time to flee. And then the Romans were going to come back. Okay. And that was going to be the death of the city. And then they were all like, oh shit. Like, some people left, some people didn't. The ones who didn't, when the Romans came back, they were like, oh shit, that was what Jesus was talking about. Fuck, we should have left. Obviously, it's just a story. Like, this isn't, anyway. They were all like, oh, fuck, we should have left. And it's like, oh, well, too bad that you didn't notice the sign when it was literally pointed out to you. This is what I feel like watching this happen with people when they say, oh, but, Hitler was taken down before he got to rise again. I'm like, motherfuckers, that's what happened in the 2020 election. You all had your chance to learn from your mistakes. And then you elected Biden. You did the exact opposite of what you should have been doing.
Yep.
Fucking hell. God almighty.
While we're off on this tangent, right, I'm gonna quickly squeeze something in. Like, I know we talked about doing it later, but it's so relevant right now. In 2019, Steve Bannon, who was then working on the Trump presidency, right, he had an interview with a program called Frontline on PBS.
Yeah.
Right? Where he said that the opposition party to Trump is the media, not the Democrats.
Yes.
The media.
Yeah.
And the media, these are Steve Bannon's words that I'm repeating here, okay? And the media can only, because they're dumb and they're lazy, they can only focus on one thing at a time. All we have to do is flood the zone. Every day we hit them with 3 things. They'll bite on one and we'll get all of our stuff done. Bang, bang, bang. These guys they'll never be able to recover because we've got to start with muzzle velocity. So it's got to start and it's got to hammer. And the host says, what was that word? And Bannon said muzzle velocity. And that is exactly what's happening with all of these presidential fucking edicts, whatever the fuck they're actually called. Putting all of these things out there, it is to give the illusion to the populace that Trump has the power of a king rather than a president.
You didn't hold our hand first. You didn't hold our hand first, Maddie, before you said this.
Sorry.
We're doing a cone to make up for it, Lily, instead. No, I was going to say, and the other thing as well to remember, and this is one of the things this is one of the reasons why I'm going to start party planning again on a Friday. I know I've been missing it the last couple of weeks because of cancer. So I was about that, but I will be doing it this Friday, promise. But one of the things I do in party planning, and one of the reasons I talk about focusing on one thing, focus on what your one thing is going to be, is because of exactly this. So even though Trump is hammering through all of these executive orders, he's trying to, flood. He's trying to absolutely flood the airwaves, flood the news cycle so that we can't focus on any one thing at a time. He is flooding them at organisations that have been prepared, that have seen this coming, and he's flooding it in ways that, for example, he's done a couple on housing that I was keeping an eye on. There are already organisations who've been working on that because they were already... So what often happens, and this is one of the things in policy when you work in this sort of space, you realise, policies don't often start with the president. And you could tell from watching Trump, he picks up things from all over the fucking place. Mm-hmm. But usually the policy will start with someone who then acts as a advocate for that policy, and they'll push it in certain circles. And often, if you're wealthy, it's easy to get in the right circles to push it at the right person who can push it through quicker. That's why we have a lot of these bullshit policies that come through really quickly. So what ends up happening, though, is that what they'll do is they'll test it first. So they'll have a testing ground, and California was a testing ground for a lot of anti-homelessness legislation that's gone through recently. And California was chosen as the testing ground partially because it has such a high Democrat population and how much they were able to get away with despite the pro-democratic sentiment. Because unhoused populations are quite easy to criminalise if you can keep people on side with it. So this was also seen by a few people as a precursor to dealing with immigration, because if we're used to seeing the cops coming and rounding up people off the street and taking them away for being homeless, it becomes normalised to see it happening for other things as well. So, but what this means is because they already tried and tested out some of this legislation criminalising homelessness in California, it means that it alerted a lot of pro-housing associations and housing, those struggling with housing, like a lot of support services were alerted to this coming down the pipeline by this other legislation going through. It's like Florida was a really good testing ground for a lot of the anti-trans legislation that we know is now coming through from Trump. We knew it was coming because it's been coming for a long time through these other testing grounds. So yes, it's scary and it's overwhelming, but the good news is that the only way that these policies were able to get to the level where Trump's advocating for them is because they've been tested and been found to be successful elsewhere, which has also given a lot of these organisations the heads up that they were going to be pushed. So there are people out there, not that I'm saying like not to panic, what I'm saying is that there are places you can go to direct your energy. If you're feeling like, fuck, what do we do? There will be organisations who will be looking at, like, pick a struggle.
For any of our American viewers, if there are any of you watching or listening to this episode, if you are safe enough and you have the fight in you, pick a cause. Find the people who are already organised. Because ever since Project 2025 was released into the public, there have been organisers building. So find people who are already organised, link up with them, and fight.
And they may not be in your area.
If you are not safe, and you worry for your safety and your family's safety, there are ports on the border between America and Canada that have opened up, and they have declared that they will allow people, even without papers, to seek asylum in Canada.
It's also
because
really...
there is problems now with people getting passports if they have trans identity markers.
It's also important to remember, because it's obviously not just, there are a lot of different groups that are affected, and some are going to be more affected by others. So there might be people, for example, who are in the trans community who are thinking to themselves, oh, this is a big drama and everything's fine. Just remember how big America is and how different the story can be from one side of the country to the other, like the same way it is here. But also, we're not just talking about trans people, we're also talking about people of colour. We're talking about people with disabilities. We're talking about people, like, we've seen what's happened when these regimes. So just don't be dismissive of other people's fear either, because it can be quite easy to go, oh my God, but it's like, we're in a sleepy little town in the middle of America and everything's fine. Okay, you're not a gay kid living in Austin, Texas, where like there are like ICE raids happening daily and you're seeing what's happening to people of colour and you're hearing what they're saying about you as a trans kid. So just bear that in mind. This experience is going to be different for everybody.
Please educate yourself
on
who were considered to be the enemies of the Reich. Please look up each of the patches. Please look up who was
very good note.
To get
perspectives.
To get an idea of who they will be coming for again. Because it's happening again, I'm telling you, right here, right now.
And my point was very much a build on Maddie's point. Maddie was making the point that, you know, there are going to be people who aren't going to be able to. And I was just saying, and don't fucking dismiss those people. So, really.
No,
and there are going to be different levels of fear for different people as well, which I think is, you know, important to keep in mind. And it will change for people over time as well. You know, there'll be times that you feel more panicked and times that you feel less, and that's going to be normal as well. You know?
Absolutely.
It's an adjustment. That should be sit for Dad.
Have your belong, and then we'll get back to what we were actually talking about for this episode.
All right, So, this needs to happen first. But you know what? If someone could just clip that for me, if anyone wants to clip anything at all, and even if you just want to publish it on your own shit and just tag me in it and I'll repost it. Like on TikTok. Tag us in it. If anyone wants to steal my content and repost it and just like post it all over the shit.
Go ahead.
Go for it. Especially if you're somewhere that makes money from posting, because we don't. So get that bag. Post them clips. Get that money. Get that bag. Get that bag. We're funny and we know it. We should get paid, but we won't. So someone may as well.
TikTok won't pay us. Twitch hardly pays us.
Twitch pays us about $7 a month, which is about what Ko-fi pays us.
Thrilling! There, but everyone that's in our fan base is as broke as we are, so, you know, we're not holding anything over you guys.
But if you do have $3 a month, I do like to...
And you've got a spare $3 Australian a month, so if you're overseas and you have a better exchange rate, then, bud, seriously...
Don't mention the exchange rate at the moment, Maddie. You'll trigger the Americans.
Get triggered, Yanks.
Trigger the I won't just say the
look,
libs
I love
then.
You guys.
Trigger the libs. Trigger the libs.
Trigger the libs. Tell them that maybe they should have thought about looking after brown people and trans kids instead of just themselves. That's how you trigger the fucking libs. You're hoping to get a new phone at the same time as coming over, so you'll learn then? Yep, dope. Sounds good. But yeah, Tugs, we're making so much money. So much money.
Rolling in it. Rolling.
The fucking sarcasm, I swear to God. We do this for love, and it's a bloody good thing that we do it for love as well, because if we were seeking to make financial profit out of this, we are barking up the wrong motherfucking tree, man.
My goal is that the Ko-fi pays for the commune. That's my goal. Wow. If we all chip in a couple of bucks a month, we can pay for the commune.
Wow. That is a big goal, my friend. Holy fucking balls. I thought we were aiming lower. I thought we were aiming for the Ko-fi to pay for a fucking editor so you don't have to do it all.
I mean, yeah, eventually though. Eventually. And that's not a lot. Like, that's really not a lot. You don't need to
Fair.
have that many. Actually, maybe it is. Hang on. We had 1,000 Ko-fi subscribers. We could pay for the commune.
Yeah. Yep.
Thinking big picture.
The link pops up in chat pretty often.
Hey?
I was just saying the link pops up in chat pretty often. As a matter of fact, I'm about to drop the link in chat now. Just so that you'll have it. This isn't me going, hey. This isn't me going, hey, you need to like pay us now. This is me going,
just in case.
Here's the link to pass on to your friends who have more money than what we do.
Shit, and I promise there is a new episode coming today. I promise. I'm sorry it was a week late. I promise, now that I have cancer, I'm going to be using it as an excuse every time I'm late from now on. That's what I promise. Yeah. Ooh.
Yeah, we all keen for a commune, Tug.
Yes,
100%.
please.
Like, can it come sooner rather than later, please?
So,
No,
Medicare, as far as Medicare, a cult mune.
Yep,
Can't wait for
let's
cult
go
mune.
back to Medicare.
So the number of medical services that have been subsidised by the government has grown exponentially over the years. Now, this number does fluctuate, and as we said, there are problems with services being removed and being... Oh, no. This is the thing. They're going to take it all out, so there's no risk of that happening. It's okay.
Oh, dope.
So, hopefully, fingers crossed. So,
Oh,
when it
okay.
was
I see
first
where Zab was
launched-
going with that.
it's cancer's
Saying it
fault.
was cancer's fault. Okay, right.
Yeah.
I was like, wow, are we just like putting thoughts out into the universe now? Is
No,
that what we're
we're
doing
not.
in this chat?
There's no, absolutely not. That is, we are not hoping for that. No one would do that. No one would wish that on me.
No.
So, the services that started out when Medicare was first launched, there were nearly 2,500 services on the Medicare scheme. Today, there are around 6,000, and that number does fluctuate. As I said, services can be removed, and with a lot of advocacy, often from medical professionals, a lot of services are being added on. There has been an increase to services over the last few years, including things like cancer treatments, which is really handy.
With an aging population.
With an
that,
aging
is
population.
something that'll go on.
Yeah. So, as far as so when it was from the time it was very first from its very inception, Medicare was described as a major social reform, and its aim was to produce a simple, fair, affordable insurance system that provides basic health cover to all Australians. And it can certainly be. We can certainly. Thank you for the subscription.
Thanks
Appreciate
so
that.
much, Carly.
You're amazing. We have to
Appreciate it.
set it up so that all of those things go off now that people are subscribing.
Yeah.
And we can certainly
cool.
agree that Medicare does continue to do that. Now, by the end of 1984, so I said earlier, that they, by the first few months, they had issued over 6 million Medicare cards. By the end of 1984, over 8 million Medicare cards had been issued, covering over 15 million people. Now, the Medicare safety net was then introduced in 1991. This was designed to offset the cost of a patient co-payment. This co-payment was later withdrawn due to people not really enjoying having that at all. Now, the safety net has been retained. A lot of people misunderstand the safety net. So originally what happened was there was a $2.50 patient co-payment, but you only had to pay that up until you reached your safety net amount. the safety net amount was, say, like $500 worth of medical care. Once you had reached your safety net amount of $500, the government said no more co-payment for you. You obviously need additional medical cover. We're not going to expect you to continue paying more when most Australians don't use more than $500 worth of medical cover.
Yeah.
So that's over and above what most pay. So we're not going to charge you any additional. We still have that safety net. Now what the safety net means is that up until you reach the safety net, you have to pay the difference, and then you get reimbursed from Medicare. Once you reach that safety net amount, you no longer have any additional fees whatsoever to pay, and Medicare will cover a lot more for you.
Yes.
Now, I have reached the safety net several times as a result of having several people in my household with chronic conditions.
Mm-hmm.
So, the Medicare safety net only applies to gap costs incurred by individuals and not by families.
Yep.
So your costs of things that are included in everyone's day-to-day care for kids, for example, isn't covered in the Medicare cost, but things like hospital cover is. So it's really weird the way that it works. Like, it's really, really bizarre. So, in 1992, families were finally able to start claiming for Medicare expenses electronically. This was the first time. Before then, you had to go in to physically claim for Medicare costs. This was changed in 1992 to have electronic claiming. Now, this wasn't electronic like we could do it on the internet or anything like that. It was done at the doctor's office through the scanning and through a terminal, not.
Yep.
Before then, it was literally, here's a piece of paper from your doctor, go into Medicare with it and with your bank card, and they will refund you the cash, or they might be able to.
And your receipt, and they will literally give you fucking cash.
Yeah.
Like, I am dating myself here, but I remember that shit.
long fucking time ago.
Oh, yeah, back when the dinosaurs roamed the earth still.
Well, yeah. Now, in 1994, there was another setback to Medicare when a charge was introduced to the telephone number for Medicare. So a free of charge hotline was introduced for Medicare that allowed people to talk to financial information service officers about options for savings, investment, and related arrangements. A local call charge was introduced for this number that was then removed. 40 years later, this number remains active 24 hours a day, 7 days a week. So the phone number for anyone who needs it, this free of charge hotline that allows people to talk to a financial information services officer, is 132011. In case you want to use it, because that's still available apparently.
Still something that's on the books.
It's still something over the books. Yes, exactly. So, some other interesting bits and pieces, changes that Medicare has gone through as well. In 1996, the immunisation register was introduced, which improved the rate of age-appropriate immunisations by, first of all, advising parents when the immunisations should be issued for children, updating them, reminding them when immunisations were due to be issued by the medical practitioners, and by informing parents about any updates to the vaccine schedules directly rather than relying on family GPs to do it. One of the things that becomes clear throughout Medicare's history is that the more information that's given directly to patients, the less pressure it puts on medical practitioners directly. However, it seems that the government just finds new ways to put more pressure on them. I don't know. It's really bizarre.
Yep.
So children under the age of 7 who are vaccinated have their details recorded on the immunisation register. And these are available to both the immunisation providers as well as each child's parent or guardian. Mm-hmm. And this just helped to ensure that there were no double-ups and things like that as well. And also it was really beneficial for keeping track of issues within vaccinations. Previously, if there was a dodgy vaccination, it was often a matter of just trying to put out a public call and hoping that people, went and got checked. Now there was a way to actually...
recalls in the paper.
for fucking vaccines going wrong.
Yeah.
Now there was a way for them to contact everyone within the country who had been issued with the faulty vaccine if it came to it. So some good safeguards with some of these as well. In 2000, the organ donor was established, providing a simple way for people to provide either objection or consent to becoming an organ donor. The register becomes a consent register in 2005, meaning that before that it was your intention to donate, but consent still either had to be sought from the family afterwards. Like it's legally it did not mean anything. It was just, hey, so you're aware your family member intended to donate their organs.
Yeah,
now
what
it
do you
is
think
also
about that?
now it is also a register of consent, meaning that if they can't contact your family, the medical professionals can take that as consent to you becoming a donor. Something people need to be aware of, though, when becoming an organ donor is that if there is a dispute between your family and the medical team after your death, your consent can be waived if your family withdraw consent, because the consent of the living person is deemed as being
Supersedes yours.
Supersedes yours a little bit. So
Somehow.
it's really important. Yeah, it's really important to make sure the people in your life are also aware of your intention, because if they are aware of your intention, they can't fight it. If they can say, well, yeah, I was aware of Tamara's intention to donate her organs, but I still don't agree with it because of my religion, then they'll be like, you knew of her intention, she gave us her consent, no, like, we're going to honour her wishes and have her be an organ donor. But if you can't prove that your family knew about it, your intention, then it becomes more difficult. Like, your consent can be fought by them. So it's really important to have those conversations with your family and make sure that they are aware, and also just make sure they're comfortable with it so that they don't have a shock when you die. That, you know, all your organs are going to be harvested.
All of my family and everyone I know that I am an organ donor,
Yeah.
and that if any of them try to fight it, I am coming back to fucking haunt them every time they go for a piss.
Yeah. I probably won't have the option anymore because they're going to irradiate my organs. I don't think they're going to be wanted anymore after that.
Yep. Well,
I
the way
did
figure
sign
it,
up to
if
be an organ
anything
donor.
still fucking works
Yeah.
when I carve
Yeah.
it, it's obviously good, so you might as well give it to someone.
Absolutely. Well, I am registered as an organ donor, but yeah, I just have a feeling radiation is one of those things they go, nah, we don't really want your irradiated pancreas anymore, love. Thanks anyway. Yeah, I have a book that is my care director that goes over everything. Yeah, they sent me home with one as well. I've got to go through. It was really funny though, because they didn't expect me to already have made most of my end of life decisions. But being raised in a cult that refused medical interventions, we had to have an advanced healthcare directive on us in order to have our religious wishes honoured. So I had to go all through all of this as like a 10-year-old. Like, I had to make end of life decisions, and it was just a matter of rote. Like, it was really just very normalized to me that people have to make these kinds of decisions about what they want done to their body when they die from a very young age.
Yeah. Yep. Not to make this darker, but I had made my decisions by my mid-20s because I wasn't planning to get past 30.
That's probably a bit
So,
darker than cult, gotta be honest.
Yeah.
Yeah.
But, you know, like, that's a thing that I've decided on as well, you know, made my choices very early. Because, it was more important to me that the choices were made than it was left to somebody else to decide what happens.
Same. Tags, same. Can't give blood anymore. That was a letdown. Haven't been able to give it since 2023. Lily, my father has made very clear his intentions to be used by science when he goes. My mother objects to it constantly. She is constantly jumping up and down about, no, I refuse, I refuse.
I mean,
and so now he's
if you knew what med students do with cadavers, you might refuse too.
Oh, he doesn't give a shit. He's like, he's determined to outlive her just so that the med students can have their way with him. He's absolutely determined. He's like, this is the hill I'm going to die on, literally. I'm like, okay, great. No problems.
I've heard stories of med students in America, not in Australia, finding someone's fucking genitals in their purse as they go to walk out of the lab.
God almighty.
Yeah.
No.
So, like,
I mean,
this is where I'm
you're
like,
dead.
if you knew what med students do with cadavers,
I've heard
But hey,
stories,
if
and this is the thing. My mum loves to pull out horror stories to try and throw my dad off, and my dad's just like, "What do I care? I'm dead."
yeah,
He does
true.
not.
And you know what? If my junk can give someone one last shock and or laugh after I'm gone, that's a pretty
Yeah.
good legacy to leave.
I got to be honest. I've met some people with some junk that I can imagine being like, "Let me just cut that off and put it in my purse because I got to show someone at home, and cameras don't exist yet." Like, yeah. Cameras exist now, so less need to just chop it off. But just saying, I went out drinking with a friend of mine, and we were sitting next to this guy, and this other, like, we were sitting here chatting with this guy, just having a good old chat with him, no problem whatsoever. Like, I knew him from work. And this other random guy in the bar turns around and goes, "Mate, you've just got the biggest dick I've ever seen in my life." And we lose it laughing because we're just like, who says that? And then Dylan turns around and goes, "Nah, mate, that's just one nut." So then I fucking lose it laughing. But here's the funniest bit. I'm telling this story later to Charlie at the back when he's emptying the rubbish. He's the bar boy. So I'm saying, "Charlie, I'm sitting down with Dylan," and this guy comes up. This nobody comes up and just goes, "Mate, you've got a huge fucking dick." And Charlie, before I can get another word out, Charlie goes, "No, that's just one nut." And I went, "Are you fucking kidding?" And he goes, "Yeah, nah, that's one fucking nut." I said, "There's not one fucking nut." And then Marco comes out and goes, "What are you talking about?" Charlie goes, "Dylan's massive nut." And Marco goes, "Oh, yeah, did you show her the picture yet?" I said, "What picture?" He goes, "The picture. It's as big as Steve's head." It's like, what the fuck? I said, "You've got a picture of Dylan's nut next to Steve's head. It's the same size as Steve's big bald head." I mean, it's not fucking... Steve was a big moldy bolt head. What do you call it? He was a big moldy... what do they call them? The guy at the front door? Yeah.
Doorman.
Can't think of what it's called. Security guy.
Let's go with that.
Yeah. And I was like, "What the fuck? Are you like as big as Steve's fucking head?" It was the end of the night. And I walked down the road and I was like, "Steve! Steve pokes his head out around. And I was like, "Are you telling me Dylan's nut is as big as your fucking head?" And he goes, "Yeah, back head rolls and all. Like you can include the whole fucking..." I'm like, "Oh my God.
Fucking Christ.
No way."
My brother, get that looked at.
Yeah, I'm having this conversation at 3 a.m. in Northbridge at the
that
top
tracks.
of my fucking
Perfect
lungs.
time for this conversation.
Of course it is. When else are you going to have this fucking conversation?
Yeah, that's the time and the location for it.
Yeah.
Fuck.
And then later on, I said to Dylan, "Are you telling me that that's seriously just one fucking nut?" And he goes, "What, you want to see it? You're trying to see my pants." I was like, "God, now I wish I'd never asked. That was the curiosity. It got the better of me. I will never make that fucking mistake again." Forget I said anything.
Man, every time after I got my genital piercings done, my mates would just throw me in the hot water. Like, we'd meet some random people and they'd be like, "Oi, did you know this one's got his dick pierced?" And they'd be like, "What, seriously?" And my mates would be like, "Oh, what, you want to see it?" I'm like, "Oh, for fuck's sake," because they know
my
that if
ballsack.
anybody, they know that if anybody asks, I'm getting it out. Like,
I'm whipping
it's
it out. Yeah.
If you're brave enough, then I'm going to reward the bravery. Fuck.
That's me with my tits whenever we'd be drinking. And this is the thing. We'd get to the... So I'd go out, and it would be so funny because I would go out with Annie, and I love her to death. But she'd turn around and she'd say to the boys who just got off stage from performing, and she'd turn around and she'd say, "It's 2:00 in the morning, and she's drunk off her fucking tits, so do not ask her to flash them or she will." And then she'd walk away to go and get us more drinks. And what do a bunch of guys have been sweating their nuts off on stage all day, have just found out that there's a bitch there willing to flash her tits if they ask nicely? What are they going to do?
Yeah, they're going to
turn around and go, "Are you really going to flash us your tits if we ask?" And I went, "Yeah." Every time.
All right. Somebody clip that, please. Cut it down to just Tamara's frame, okay? And say that on the Ko-fi, the rest of the video that's cut off by the bottom of the camera exists, and we will fund the commune within a week.
Yeah. I let them know it's pre-breast cancer surgery too. Woo!
You've got to make sure that the bottom of the shirt that you're lifting up comes up into the frame.
Oh, yeah. Then it's more obvious that it's...
Yeah,
there you go.
Exactly. There you go. Yeah, the rest of the video exists on Ko-fi, you guys, because this is also being recorded on a phone.
Sam clipped it.
For
That
legal reasons, the rest of the video may not exist.
we
This
do
is a
not
loot box
guarantee the
situation.
existence of the rest of any video. That's cool and all, but Luca just got traded to LA. That means nothing to us at all.
Basketball.
Oh, well, okay, it means nothing to me. Let me rephrase. Let me rephrase. I have no idea what you're on about, but
Sorry,
it does on
Yogurts.
my
This is,
imagination.
in case you haven't recognised by the accents, this is very much an Australian podcast. We don't
Yes.
really follow the NBA here,
No.
apart
So,
from the diehard fans.
in 2002, Medicare is modernised once again as we begin.
What a fucking segue.
Yeah.
So,
So, just like you can pay our Ko-fi online and get extra benefits, in 2002, you could begin getting additional Medicare benefits through their online portal.
There
Medical
it is.
providers, in particular, are able to lodge claims directly over the internet, including Medicare bulk billing, private patient, and Department of Veteran Affairs claims.
Yep.
So, yeah. In 2004, we extended the Medicare safety net. Amazing. Brilliant.
Yep.
Smooth, yes. How will this affect LeBron's legacy? His kid's playing now. Isn't that his kid's job? Oh, suddenly I started really craving like a chicken and mayonnaise roll. Oh, we had roast chicken the other night. I wonder if there's any of it left. Oh, that would be so
probably
good.
let's smash out the rest of this so you can go raid the fridge.
I'm so hungry. Okay. This is what the weed's good for.
Yeah.
Because I ain't been hungry lately. So the safety net is expanded. The Medicare safety net is expanded in 2004 to again cover 80% of any additional out-of-costs for out-of-hospital services. Now, this is obviously once that annual threshold of patient spending is reached. This provides benefits to eligible individuals, couples, and families that have high out-of-pocket medical costs. The electronic claim lodgement information processing service is improved, which now means that more people can claim via these services, which is fantastic. And over the next few years, there's a lot of access points and better access schemes that are developed to try and help ensure people are better able to access the Medicare service. Because while healthcare professionals deal with it daily, patients only really are ever dealing with it when they have a medical issue. So because that's not really all the time, people are having to relearn the system. So they're trying to simplify how it's done. And this continues right up until 2011, when they seem to almost start on a backwards trajectory with this. Really weird. Who took power in 2011?
I wonder. Who was it?
Oh, I can't really remember. It's bizarre. But anyway, Medicare gets lumped in with Department of Human Services. And as a part of the co-located office, which helps to boost the number of Medicare sites from 240 to more than 500. However, during this same period of time, the number of staff does not increase. The staff who are taking care of Centrelink are simply expected to pick up the additional tasks of Medicare staff. This has been corrected at different points over time, but while Medicare staff have been introduced, Centrelink staff have been reduced. So it seems to be more of a piggybacking on services that already exist rather than expanding services that's been going on. And it's been advertised to us as though they were expanding services. So
It was Tony Abbott's favourite trick, though, is looking like he was doing something beneficial while doing nothing.
Yeah, doing bumfuck nothing. Now, one benefit during this period was that as a result of being amalgamated with Department of Human Services, Medicare is now able to be managed through online self-service portals for the first time, which means that people are directly able to take note of things like threshold limits and payments. And this gives people for the first time in a very long time access to actually see the system, which did backfire a little bit on Abbott and his government, which, was good.
Love it when that happens.
Yeah. And then in 2013, the Express Plus Medicare app is launched, which people can get their Medicare cards and everything through the app now, which also helped reduce a lot of costs because mailing out Medicare cards, especially to regional and remote areas whenever one goes missing, was a massive, massive cost. And I don't know if people have noticed, but they don't automatically send you out a card now. You have to request if you want a new card sent out, which is fine. Like, it's not a problem at all, but it used to just be automatic that it would get sent out. And now it's like, do you want a new card? Like when you log in, they ask if you want a new card for the year and you're like, yeah. And then they'll send it out. But otherwise, yeah. But you've got access to it all on the app. So, you know, with the changes and things, it's not all bad. Now, the Health Delivery Modernisation Program was commenced in 2018. Now, this program said that it was designed to strengthen primary health care through new digital health services and by modernising the health payment system. But interestingly enough, it really seemed to instead remove the amount of money. So a lot of additional staff were required for a lot of this modernisation that was happening, but doctors' offices were being told that because the government was spending all this money modernising the services, there wouldn't be any additional payments going to doctors. So a lot of this investment the government was doing seemed to be a way of, I'm not casting any aspersions, but there were a lot of government contracts that were given to people that gave them a lot of money that was like, yeah, we're spending money. It's like, okay, right now the government says that they're spending a lot of money on housing by investing a lot in getting services connected in regional communities so that developers can go in and clear the land and make money off selling these blocks of land that the government has now connected up to services. It's a way of being like, look, we're supporting the community when actually they're giving money to private businesses. They're helping private business. Yep. This kind of smells like that to me. We're saying we're investing money in Medicare, but really we're investing money in private IT companies who are developing this technology under the guise of investing in Medicare. And because there's this advanced health delivery modernisation program, there's a lot of extra training and things that go on, but there's no additional money that's coming into doctor services to pay staff, like to pay receptionists and other support staff, including nursing staff and things that they're expected to have to be able to streamline processes during this time. So there's a bit of a commosul, and this is again what I say, the biggest advocates for Medicare are the medical staff because they're the ones who are most directly affected when Medicare is not adequately funded, and they push back against it, which is amazing. Now, Services Australia began in operation on like the 1st of February in 2020, as we know, which is, you know, Department of Human Services just under a different name. Yep. And this program was aimed to simplify government services such as Medicare and Centrelink so that we could get people throughout Australia could get on with their lives. This was very notably right at the beginning of COVID shutdowns and things as well that this all happened. So it was during a huge uptick in the amount of demand that both was the hospital system had on it at the time, as well as Centrelink services had on them at the time. Yep. And the staff were expected to be going through, like, they hadn't really had a lot of training on this, like, new approach beforehand that this all came out. So all of this sort of resulted in the government deciding to investigate. The Strengthening Medicare Task Force report was released in 2022. It was reportedly, the purpose of the task force was to recommend what could be done in the immediate future to try and strengthen Medicare using the $750 million fund that had been set aside for this purpose. It was also asked to provide recommendations for longer term reforms and what investments could be made in the primary care system. And it had a lot of recommendations, particularly one of the biggest ones, which was taken on board and has been implemented in some places. And one of the reasons I wanted to talk about this today was because one of the recommendations of that 2022 task force, which has come out, is Medicare urgent care clinics, which have been opened. Now, Medicare urgent care clinics are one of those policies that the Greens have had in the back burner for years. Okay, I know I'm not a Greens advocate. Everyone who knows me knows that. Yep. But like with gun reform, it's a policy that the Greens had in their back burner for years, that a government was like shown a problem, it was thrown in their faces. They then saw a policy that had already been demonstrated to have worked and have been costed that was provided by somebody else, and they grab it and then they ride the wave to get that policy through. This relates to what I was talking about earlier with Trump. Like, all of the policies and things that he's grabbing onto and riding the wave of are things that already have momentum behind them, because that's what these politicians do. They don't get into politics. Yeah. They don't get into politics because they want to champion a cause. They get into politics to champion themselves, and then they find causes that the public think are popular and champion them to gain popularity.
Yep.
So we're quite fortunate that the Labor government, the Albanese Labor government, has decided that Medicare urgent care clinics are one of the things they've decided to glom onto as one of their policies. So they have been claiming that as one of their policies, which is great. The Greens are pushing them to open a few more clinics. So I would definitely say vote for your local Green in your upcoming election, because even if they don't get elected, you get them more funding to be able to advertise and push for things in their advertising, like urgent care clinics for GPs, and push that further in the zeitgeist that that's a thing that we need, or whatever else it might be.
Before anybody accuses anybody of anything, both of us have our serious problems with the Greens.
We both have issues
that we would like to, pull the party apart and redevelop it to make sure that it's actually doing what it's supposed to do.
Yeah.
There are certain people who absolutely need to go within the Greens.
Yes.
But
most of the upper
in
leadership.
saying that, yep, absolutely, and half of WA. But in saying that, as Tamara said, we've got preferential voting.
Yes.
Put your Greens candidate first, even if they don't win. Every vote means money.
Or
every
put them
bit of
second
money,
behind another independent candidate you like better if you've got on a better option.
That you like better. Yeah, absolutely.
But do not put either of the major parties first.
Ever.
I'll disown you myself.
Yep. I will haunt you every time you go to the bathroom.
I've made so many videos on this. They are honestly in my voting section on TikTok. I have made so many videos on this. Every time there's an election, I'm like, if you put one of the major parties first, I will disown you. I will haunt you. I will murder your children for 7 generations. I will cast a curse upon you that haunts your family for 7 generations. It'll be blood and destruction upon them.
I'm not biting anyone, people like that. I'm not offering that
too many
as a
fans
punishment.
of the biting. Biting and scratching, I've learned. Too many are into that.
Oh, yeah. Primal shit, man.
So, yeah. So the Australian government has established a network of national free walk-in Medicare urgent care clinics, which give a lot of Australians access to a local healthcare provider when there isn't a GP available to them. As we were saying earlier, one of the major issues that Medicare has had in recent years is the fact that there isn't there isn't necessarily a GP available to you. Now, when I was younger, when I was growing up, there were most bulk billing clinics operated like urgent care clinics. You could walk in and just sit there and wait for a doctor to be free and then be seen.
Yep.
That is not the way the doctors operate at all anymore, which is great if you've got an appointment. Fabulous if you've got an appointment, if you can get one. But for people who need urgent care, we need the alternative like the urgent care clinic. And, if you've found a lump and you've got to wait 3 hours to see someone, it's much better than having to wait 3 weeks to see someone,
Correct.
Yeah. Madam's Renable Curse, you and your family, yes. The wheelchair changes things for people. Do they get out of your way a little bit? They just move out a little way a little bit. So one of the really good things about the Medicare urgent care clinics as well is that it's been greatly reducing the pressure on emergency departments. Now, I want to be really, really clear about something. I don't in any way, shape or form want anyone listening to this to think that because there are such a thing as urgent care clinics, if you are concerned and you don't have access to an urgent care clinic, it doesn't mean you should put it off until you can access one if you have medical concerns. Yeah. I literally spoke to my emergency department down here about this, and they honestly said to me, even if it was something as simple as just wanting a referral to go and get an ultrasound done, I could go in there and ask the doctors on duty for that if it really came down to it. Like, at the end of the day, most medical staff do want to help and will try and find ways to help. There will be the ones who get annoyed that you've come down there and asked for help, but that doesn't mean you're not entitled to go in there and get the help and just go, you know what, fuck you, who cares if you think it's a panic attack, just write me my fucking referral so I can go and talk to someone who's got more brains. Like,
absolutely.
You know,
they can get as annoyed as they want, they still have to do their fucking job.
Yeah, exactly.
Also, really beg to differ.
Yeah, I was going to say I wouldn't. It takes Ride Me to a whole new level. Now, currently there are around 60 clinics around the country.
Okay.
Yeah.
Continue.
So, now.
Oh, what a fucking pickup line.
So Medicare has actually just celebrated 40 years. I have a spare battery now. I can go all night. See? There you go. Drive me around. Drive me crazy. The Medicare program has celebrated 40 years as of 2024. So that's the other reason I thought, it's very timely to talk about it. And they're around the same time, or just the year prior, the newest update is My Medicare, which is a program that allows patients with a Medicare card or a veteran card to register with your GP for basically that, like My Medicare medical continuity of care, where basically all of your records will go back to your GP. Like whenever you go and get any tests or anything done, like I said earlier, though, in 2025, the year of our Lord 2025, saying my family GP is like saying, my family manor. So it doesn't really feel accessible, but the government is still trying to, this goes hand in hand with the urgent care clinics. So what you can do is go in and go to an urgent care clinic to get urgent care and have all those records go back to your GP so that when you are able to go in and see them, you've already got tests and records and things done. So book in with your GP, go to an urgent care clinic to get the tests done, then go and see your GP for the results so that you can kind of... While the system is not great, they are trying to find ways to bandage together what we have, which only happens under Labor governments or under left-leaning governments. Under more right-leaning governments, particularly when they have greater support from, say, the Liberal Party with more Liberal members in office, they tend to get worse for all patients everywhere. So if having more services and more updates to Medicare sounds like something that you would be for, this is part of our election range, 2025 election section. The election, we need a special, what do you call it? Special intro, special outro for the election. So that's the end of my election pitch. Don't vote for right-wing numpties that look like potatoes this election season. If you want improvements to Medicare and you don't want it to get worse, don't vote for the evil potato.
If you want improvements to society in general and you don't want it to get worse. Genuinely, I'm just going to say his name because I don't care. Do not vote for Dutton. He is a scumbag. He is a liar. He is not going to do half of the shit that he says he will, that he's claiming are going to be things that he wants to do to advance society.
Timu Trump. Fucking Timu Trump. No fucking way. That's so fucking good. Timu fucking Trump.
So
fucking Timu Trump.
In, all right? Just don't do it.
Please don't. Please don't. In saying that, now that I know that it's not that, long COVID is a perfectly adequate reason, but now that I know that it's cancer, I'm going to sign off because I'm tired now, and I'm tired because I have cancer.
Perfectly fair and valid. We will end the stream here, so let me just jump on in and we'll get our usual outro.
Right up in that mic. Get right up in that mic.
With some additional Vladimir purrs. Thank you so much for joining us for this week's dive into the depths of the trash fire that is Australian politics. If you've enjoyed what you've seen, make sure to drop us a follow and do all the usual engagement things to help us get the word out there. You can find Tamara and myself on the social media links in the description below. But for now, it's garbage day, so the girls gotta take the trash out. Bye.
Bye.
Love you guys. Have a good one.
Bye. It didn't end. Do I have to hit end?
Yeah, because you're hosting it.
Oh, can you not end it on your end?
I don't think so. Let me try. Maybe I can. All right. Bye, guys.
Thank